Tus protegis languam contrai peligro nafan safuham. Tus protegis languam.
Driving round, windows down, warm breeze and a soulful sound. I got my mind made up about where I wanna be. Can't nobody take my heart from me. There is no place like home. Send guys out gone. And I'm proud of where I'm from. Yeah, there's no place like home. Palm trees sway both night and day. Paradise is the only way. I got my
Good morning, Guam. Hey, good morning on you. Morning, Sabrina.
Good morning, everybody.
6:32, Monday, the 27th day of April. A lot of news for you guys today here on the KUM News Takeover of Guam's favorite. It's containing COVID. My name's Chris. Good morning. There's just so many ways you can catch the show. Of course, right here on the radio, 93.9 FM. I got you, Guam. We're also streaming on the KUM News app and at KUM.com. There's also an audio stream at Docomo Channel 10, and then we jump over to KUM TV 11, 8 to 10 in the morning. And, of course, our Facebook listeners watching us, Facebook viewers listening to us on KUM News Facebook. Good morning on you guys.
Hey.
Sorry for a little bit of a late start. We were doing our Adelaide press conference invitation again.
Wow.
So we're ready now. Are you ready?
I'm ready.
Let's do it. As we always do, we start the show with a deep dive into the day's COVID-19 news. And, of course, from the KUAM News team with the very latest, Sabrina Salas-Mazzanani. Good morning, Sabrina.
Off at a good morning, everyone. According to the latest from the Joint Information Center released at 9:25 last night, Public Health and Social Services tested 37 individuals for COVID-19 on Sunday. 0 tested positive through Public Health and 37 tested negative. The results include remaining samples for COVID-19 pilot project testing in Estumbo Dededo. To date, 141 cases have been confirmed through COVID-19, with 5 deaths and 128 released from isolation. And again, the pilot test for community COVID-19 testing on Guam was launched in Dededo on Saturday, with the Department of Public Health's lab in Tamuning testing 47 samples from 3 batches. Fortunately, no positive cases of coronavirus were reported in any of those batches. The first batch contained 141 samples, the second batch had 17 samples, and the third batch is comprised of 16 samples from the Estumbo site and GovGuam's quarantine sites. All the samples across all 3 batches returned negative. Overall, 52 samples were collected at the Estumbo Gym pilot testing site Saturday, and again, according to the results released on Sunday, all tests over the weekend were negative for COVID. Speaker Tina Munoz-Barnes has closed her office following a staffer who presumably tested positive for COVID-19. The test was sent by Diagnostic Laboratory Services to Hawaii for confirmation. The Speaker's office was notified late Friday evening about the staffer. Over the past few weeks, only a limited number of essential staff had been working in her office, while others were teleworking. The employee had been working from home, but this past week physically came to work on Tuesday and Wednesday. All employees were in contact with the individual, including the Speaker, to aim to get tested on Monday. Although the doors to her office have been closed, the Speaker and her staff will be working remotely to allow for decontamination and sanitization procedures. Senator Biscoe Lee, in the meantime, has written a letter to the governor urging her to dedicate at least 10% of the $100 million plus Guam received recently from the CARES Act for direct aid to our unemployed and underemployed residents. Quote, people are hurting because help hasn't arrived. Many can't afford to wait another day. Funding may have been the issue 2 weeks ago, but certainly isn't the case now. Recently released guidance from the U.S. Treasury allows states and local government to use CARES Act funding for necessary expenditures incurred due to the public health emergency. The lawmaker suggests the governor could use some of the CARES Act funding for food delivery to residents, grants to small businesses, direct financial assistance to residents, and vouchers distributed to residents for food or other necessary items. The senator saying, quote, they need it now more than ever. Meanwhile, Republican Senator James Moylan is taking matters into his own hands and is hosting his first community virtual forum this Wednesday from 11 a.m. to 12:30 in the afternoon. The senator is hoping people will join the virtual forum to respond to constituents' most asked questions and concerns. Some of those topics that will be covered include transparency, unemployment, relief and assistance. The virtual forum will be done over Zoom. For more information, you're urged to check out his social media platforms or email his office at Senator Moylan at GuamLegislature.org. The remaining economic impact payments that the government of Guam is advancing will be mailed out. According to the Department of Revenue and Taxation, about 3,800 checks were transmitted to the Treasurer of Guam. A total of 7,005 checks were printed for a cumulative total of nearly $11 million. These checks are for those individuals who filed and had income of less than $10,000. Checks were distributed in batches to allow for Guam's financial institutions to remain compliant with social distancing protocols. The remaining EIP checks are still pending approval of DRT's implementation plan by the IRS. Over the weekend, President Donald Trump signed a new law that replenishes the Paycheck Protection Program with $320 billion in additional funding. Before the PPP ran out of funding, 508 local businesses received about $102 million in loans as part of the initial PPP. Governor Lilian Guerrero opted to cancel her daily media briefing on Friday and instead issued a Facebook Live response to a business owner's message that went viral over social media.
Good morning and half a day. I was asked yesterday at our press conference about my comments and my response to a letter from a Guam business owner. Here is my response. Dear Guam business owner, I live on the same island as you, and though you might feel I'm far away while dealing with this crisis, I've always been right here. I asked you to help, you did. I asked you to close your business so we could save lives and lives were saved. I asked you to stay home so we could stop the spread, and it is working. I asked you to continue to stay home to keep us safe, and you are. I know you are at home waiting. I told you unemployment checks would come, and we submitted every document for federal approval within days of being allowed to file for it. I told you small businesses grants were coming, and they did. Just ask the 502 small businesses on Guam that got their share of $102 million last week, the largest per capita award among the territories. I told you, don't worry, forgivable loans are coming, and these same loans are forgivable so long as you use them to keep people working. I told you stimulus money is coming, but it hasn't come fast enough, even though we were the first territory in the nation to file for it. That's why I advanced nearly $11 million in stimulus checks to our most vulnerable neighbors, something no other territorial governor has done. During this crisis, we processed $100 million in cash, food, and medical assistance. 500,000 meals were given to Guam kids, and meals to the elderly have never stopped. But still, you wait at home. I know that some people think becoming governor gives you the power to make everything better with the wave of a wand, but that is not true. No matter how fast we work to submit our paperwork, we can only work as fast as the federal bureaucracy allows. That frustrates me more with every day that passes, and I am angry that you are made to suffer because of it. But here's what you need to know. The virus kills and will kill many more of us. We must continue to prioritize the health of our people. We lost 5 loved ones to this virus, and the world lost many more. I won't let their sacrifice be for nothing. In the next few days, I will present a recovery plan that will start returning our lives to some normalcy. It was worked on by medical and public health professionals, the business community, and government agencies like GITA and GVB. My goal is to get Guam working again, but to keep Guam safe while doing it. I've heard you, and whether you agree with my decisions or not, I am glad you are alive to hear me. Thank you, and Sidus Maasi.
News from the CNMI. Governor Ralph Torres issued a special address saying that our islands and the whole world have been devastated. No one could have predicted we would have been in a situation like this. We have several direct charter flights from California, South Korea, and other parts of Asia, bringing in 40,000 test kits of the 60,000 that have been purchased from South Korea. 70 additional ventilators, medical equipment, as well as thousands of PPEs, including 48,900 masks, 217,000 gloves, more than 12,000 isolation gowns, face shields, and hazmat suits, as well as hundreds of thousands on the way for our doctors, nurses, and first responders. Governor Torres also saying through our partnership with FEMA, the U.S. Department of Health and Human Services, DOD, our 40-bed medical care and treatment facility outside of CHCC will be open today, while our alternate care site at Kanoa Resort is scheduled to be operational in mid-May. He says plans for our community-based testing are being finalized. An update now on the USS Theodore Roosevelt. 100% of the crew have been tested for COVID-19, with 833 total positive and 4,100 negative results. A small number of results are still pending, though. Of the total cases, 112 sailors have recovered and 4,200 sailors have moved ashore. 2 sailors are now at Naval Hospital, and none of them are in the ICU. Meanwhile, over the weekend, the recommendation to give Theodore Roosevelt Captain Brett Crozier back his ship was made by the Chief of Naval Operations, Admiral Michael Gilday, who had ordered an investigation into his ousting. Here's more from Brian Martin.
The recommendation to give Captain Brett Crozier back his ship was made by the Chief of Naval Operations, Admiral Michael Gilday, who had ordered an investigation into the head-spinning tale of coronavirus at sea. Gilday's recommendation to reinstate Crozier in effect exonerates the captain for blasting out an email warning sailors would die if the Navy did not act faster to get them off the infected ship. Acting Navy Secretary Thomas Modly fired Crozier for sending his plea for help outside the chain of command.
That demonstrated extremely poor judgment in the middle of a crisis, because what it's done, it's created a firestorm.
Crozier, who has since tested positive for coronavirus, was cheered as he left the Roosevelt in Guam for what seemed like the last time. Modly flew there and delivered a rant against Crozier, which antagonized some of the crew.
He was A, too naive or too stupid to be the commanding officer of a ship like this. The alternate is that he did it on purpose.
That speech ignited a second firestorm, which forced Modly to resign. Afterwards, he required 24-hour security because of death threats against him.
Defense Secretary Esper has not yet decided whether to accept the recommendation. Crozier remains in isolation on Guam and must test negative for the virus before he can rejoin his ship.
News: the White House is doing damage control after President Donald Trump suggested that Americans inject themselves with disinfectant to get rid of the coronavirus. The coronavirus task force did meet, but they did not hold a public briefing. Nicole Killian is at the White House looking into whether there's a shift in strategy.
With the temperature reaching into the 60s, New Yorkers tired of staying indoors flocked to Central Park and other scenic spots.
Thank you very much.
President Trump didn't take questions during a Friday night briefing at the White House, cutting it short after about 20 minutes. Press Secretary Kayleigh McEnany says it's not necessarily a sign of things to come.
I leave that to the president. That's entirely his decision, but I believe the president's at his best when he's speaking directly to the American people.
She also said the president's comments were taken out of context when he said this about disinfectants Thursday.
Is there a way we can do something like that by injection inside or almost a cleaning.
Less than 24 hours later, he said he was just joking.
I was asking a very sarcastic question.
But the maker of Lysol didn't take it lightly, stating, under no circumstance should our disinfectant products be administered into the human body. The Centers for Disease Control cautioned disinfectants could cause health problems when not used properly. Dr. Anthony Fauci stayed away from the controversy as the president tweeted the U.S. has now tested more than 5 million people.
We're doing about 1.52 million per week. We probably should get up to twice that as we get into the next several weeks, and I think we will.
Additional money for testing and hospitals are part of a $484 billion measure signed by the president. It also replenishes the Paycheck Protection Program, targeting more funds to rural and minority-owned small businesses. With millions filing unemployment claims, White House economic advisor Kevin Hassett projected the jobless rate could hit 16%.
We're going to have a very bad unemployment report, the first week of next month.
Bank of Guam and Coast 360 Bankers Association members are collaborating to assist the community in cashing their stimulus checks in order to adhere to social distancing measures. Check cashing is allowed for non-customers at Bank of Guam, Bank of Hawaii, Bank Pacific, First Hawaiian Bank. Additionally, the GBA reminds the community that ATM deposit and mobile deposit are convenient and safe banking alternatives. Those with no banking relationships may be asked to line up in a designated non-customer check cashing line and will need to provide 2 valid IDs. Again, that's your Banking 671 tip from Bank of Guam and Coast 360. And finally, May 5th is Giving Tuesday now. Please participate. Communities around the globe are getting together on May 5th in a sign of solidarity against the COVID pandemic. Be a part of this day by making your donation to a local frontline organization on island. Whether it's the Mayor's Council, hospital, fire department, or even somewhere else, your donation will not go unnoticed. Remember, no donation is too small, and it can range from PPEs to food or other supplies. We want to be sure that we recognize all of you coming together. Post your donations on social media with hashtag Giving Tuesday Now and hashtag Giving Tuesday Guam, and we will feature them in a special episode on May 5th.
All right, there you go, Sabrina Salas-Mentanani with a deep dive into the day's COVID-19 news. Where's mine?
You can have this one.
Okay, so yeah, I don't know if you guys got the memo, but today is Bring Your Own Magic Wand Day. So alakazam, alakadoo, let's give more power to Governor Lou. Okay.
Did you just think of that?
I did. A lot of
you
words
sure
rhyme with
Lou. You
Lou.
hadn't been practicing that all weekend. Come on.
Okay,
but this
Jake,
is our Giving Tuesday.
Yeah, it is.
Our Giving Tuesday.
Chris, basically, like the entire movie making industry is on hold right now because of the pandemic. But I think you just gave Disney the premise for Maleficent Part 3.
Wow. That's a good one, Jay. Hey, we got a bunch of comments here. Keep them coming on the Facebook Live. Of course, the governor came out with this response to a meme, basically, Friday. And we didn't really get a chance to talk about it because it came out after the show. So, yeah. And it was definitely the talk of the weekend. Not sure where to start in unpacking that because I feel like that question was answered by the governor when KUAM asked it on Thursday's press conference. Remember we played a clip of Adriana?
Yeah, we did. All morning Friday.
Yeah. And so it was pretty interesting that they decided to, I guess they needed some content, is what I'm thinking, that they would decide to respond to something that the governor already responded to. And, I mean, the whole authenticity of this viral message, I feel, was, did a Guam business owner really write it? I know that it was going around nationally and that I had heard some people just copy-pasted it and put a few things in there to make it Guam-centric. Mm-hmm. And so, obviously, Adelup thought it was important enough for the governor to do a whole video on, which was kind of, to me, a boneheaded move. Like, why would you do that? Why would you make our governor say that we think she has a magic wand to just wave away our problems? Who is calling the shots up there? Who wrote that? Who allowed our governor to go out and basically bash on we the people? What are they thinking? It's crazy. I don't get it. I just don't get it, Bree. I'm sorry. I couldn't believe it.
Well, too bad you can't wave a magic wand to make that disappear.
Let me try. Oh, yeah. So we're actually using this moment to promote Giving Tuesday Now, Bree, which is coming up on May 5th. I know we got a commercial out about it.
Mm-hmm.
You got more info on that?
yeah, basically, as I mentioned, we're asking people to, on that day, Giving Tuesday, we do it every year, and it's usually in November.
Right.
So because of the pandemic, across the globe, they've set aside this day, May 5th, for people to just do something kind, something nice to show your support to our frontliners. It could be any sort of donation. Salvation Army, they have been collecting canned goods to help the thousands of people that have that are hungry, that haven't been provided any sort of local assistance. So they've been, what was it, Major Tom Stambaugh, he said that they've seen over 140 people, new people, coming and receiving canned goods and donations. Then, of course, the Grab and Go program. They're constantly seeing an increase of people coming and getting breakfast and lunch for their families. And the good news about that is the Department of Education announced that they're going to continue that over the summer.
Yeah.
The governor signed, I think it was a contract to make sure that it continues.
I think she provided funding.
Right.
Right. Yeah.
So, this is just a way. It can be something small, just to give back. You can give PPEs to the mayor's office or to the Guam Fire Department. I think we may be taking donations here. I just saw the bins up in the front in our office. But yeah, so if you can, take a picture when you do make your donation and use the hashtags. Give Guam. What are the hashtags? It is Giving Tuesday Now and Giving Tuesday Guam.
There you go. It's a good thing. Thank you, Sabrina.
Hey, you're welcome.
Yeah, so, there's been some developments that came on with Senator Regina Biscoe Lee, and she's scheduled to call up on the show a little bit later. But pretty interesting in that we know that the governor and Gov Guam got a huge chunk of federal money. I think it was 100-some million. And so Senator Regina Biscoe Lee, there was some guidance that came out from the Department of Treasury, which basically said that the governor has the ability to use this $110 million, some of it to be used for financial assistance and for, I believe, feeding programs too, right, Bree?
Right, I'm trying to pull up the guidance.
Right, well, we're going to get to it. We got to take a break. So it's 6:52, and you're going to be hearing from some of your senators this morning. Of course, we're going to talk to Dr. Hoa Wen of the American Medical Clinic and find out his take on this weekend's pilot program in Estumbo. It is the KUAM News takeover of Guam's favorite, I-94. Good morning on you.
Be healthy. Be informed with ITD.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
Self-storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Hafade Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person in this community to stay home. COVID-19 cannot survive if we do not feed it, and that means staying home and washing our hands. Now, I know I've heard people my age in their mid-20s say, it's okay, we're young, we're healthy, we have strong immune systems, we could fight it. That's not true, and we also don't know who we could potentially be exposing. The only way that we can fight it is if we stay home. It is our duty to stop the spread and to stay home. Be safe, Guam.
Self-Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Specialist Joshua Mansonotia. I can't wait for him to come home. Keep us safe and stay home. I miss my daddy, and I can't wait to see him. So keep us safe and stay home.
Good morning, Guam. Alakazam, Alamimosa. Please get the people of Guam the help they're supposed to.
Oh, we're gonna. I see what kind of morning this is gonna be.
I just had to get my wand. I'm just dealing with it. Guys, I upgraded my wand here.
Really prickly.
The Puti Tainobu wand. Okay, it's really prickly to keep away the pesky media. No questions. No, don't ask me about local aid anymore and the stupid poor people. Stop. Tired of hearing it. 6:58. It's Containing COVID, the KUAM News Takeover, Guam's favorite. That's what kind of weekend it was, basically. The 27th day of April, and we're going to be talking about some Facebook stuff this hour, and we'll start with Dr. Shay and his most recent Facebook post. Bree?
Right, so Dr. Tom Shay, he posted on his Facebook page, "Sometimes I feel so frustrated. Why do doctors, nurses have to ask for donations from the public to buy supplies for GMH? Don't get me wrong, I donate to GMH all the time. Right now, the people, are already suffering, lack of work, some lost their jobs, so please keep your money and use it for your own families, especially if you have kids. Our government is responsible for providing our doctors and nurses with the proper protective equipment and supplies to care for patients and to protect ourselves. Where is that stockpile? Many of us have asked, but zero answers. We need transparency. If there are no supplies from FEMA or Homeland Security, tell us so, or if there is, let us know. We don't buy duplicate supplies. That said, I will continue to do my best to help our island hospital, but those of you who need the money for your family, please do not donate. Keep it for you and your family. There is no shame for not donating. Those who can will, but we must hold GovGuam accountable for not providing the supplies. If we, the people, can buy them and donate to GMH, this means GovGuam should be able to buy them as well. Hoping tomorrow will be a better day for sun to shine through."
All right, 7 a.m. So on that note, let's bring Dr. Shay up on here. Good morning, Dr. Shay.
Morning. How are you?
We're doing okay.
Yeah, we're doing okay, but I'm just wondering here what it's going to be like for you at the hospital today when, people find out that you're saying don't donate to the hospital.
They're probably going to hate me for it. They'll probably get mad, but that's the truth. Sometimes the truth is a little tough to swallow. But I heard the government received $117 million, so that's a lot of money. No matter what money we're going to raise, ain't going to come to even close to that. But what's frustrating, like I said in the Facebook, is that we've asked FEMA, we've asked Homeland Security, hey, where's the stockpile? During the pandemic meetings, you say, oh, don't worry, we got a stockpile. We have stockpiles ready for the pandemic. But when we ask, they go around, what do you need? What do you need? And then they say, oh, yeah, we don't have that in stock. Or I heard that there's containers that came in, but they don't want to tell us what they are or what is inside that containers. But, the fact is, it's the government's responsibility to provide these masks, equipment. And don't tell me that, they're out of supply, they can't buy it. Well, then how is the people buying it with their own money on the outside and giving it to GMH?
Right.
There's got to be vendors out there that does that. So, the excuses are there. But I think the key here is that I think if businesses want to donate, fine. because business donate to hospitals all the time. It's okay. But I think the people right now, you know, you hear, I hear, where's the stimulus checks? Where's the money? They're not working. They got to buy food for their kids. They got to put. Those people don't donate, please. But I think sometimes they feel the pressure to do so.
Right.
They feel the pressure to participate.
Doc, I heard a couple weeks ago there was something that one of the COVID response people, I don't know if it was the governor, Linda, or somebody had said that there was a stockpile of supplies at Public Health. This is before FEMA dropped them off. And I don't know if it was Estevez. So we've already burned through that, and then now we've got the ones from FEMA, right? There's a bunch of containers somewhere.
Well, I don't know if we burned through whatever they got. We never got accountable for any supplies. We've asked, what do you have? Let us know what you have. How many masks you have? How many gowns you have? How many hand sanitizers you have? You know, things like that we say, hey, let us know so we don't buy duplicate stuff. We want to help you, but you got to help us. If you don't tell us, don't be transparent, then, hey, you know, if you got 2 boxes of cereal in the refrigerator, what is it going to... What am I going to do? Go out and buy you 5 boxes of cereal so you can feed your kids? Tell us what you have in the refrigerator.
You know, Doc, you're not the only one who's been calling for transparency. You see that from the Guam legislature. Why do you think there is this lack of transparency going on?
I don't know. I can't answer that question. But, you know, transparency is within the government system is good because if you want the people to follow you, you know, you got to be transparent. There's nothing wrong with being transparent. If you're going to give a contract to certain entities, be transparent about it. You know, it's not this lack of transparency is the one that's going to get people upset, and you're going to lose trust in the people. And this is a pandemic. If you want to lead, you got to be transparent.
Mm-hmm. Well, you know, you go to the Guam Memorial Hospital about it every single day.
Every day.
Every day. Are you seeing? What are people saying there? Are they experiencing a shortage of supplies?
We do. You know, I get messages from Command Center all the time saying that, hey, we need masks, we need this, we need that. And we've asked, our doctors have asked. And I don't blame the doctors for asking. I don't blame the nurses for asking. Because we do need those supplies. But, you know, I think FEMA, who's here, and the declaration of emergency has been declared for, 2 months now? You know, Homeland Security is supposed to have that stockpile. And when we ask them, they say, oh, yeah, let us know if you're short. Well, you know, we are short. You don't have to. That's a given. You, the one, should be asking the GMH, what do you need? Not we should be asking you.
Or just maybe drop a load off over there, right? Hey, we'll just drop some stuff in the front for you guys.
Keep that stockpile at GMH. Stop keeping it in a container where there's no aircon or whatever it is. But, you know, it's very frustrating. So that's why I posted that. You know, I'm also living alone, too, so sometimes in the middle of the night, I either cook a meal or I feel frustrated. I go, yeah, let me try to cook.
You're so frustrated, you're keeping your cereal in the fridge.
My cereal's gone. I was like, why is that? I ate them all. But, you know, I think I don't know. I'm not a bad guy. I just want more transparency. That's all. And I think that's not too much to ask.
No, it's not. And I see that, you know, with the public, again, I feel like we're doing our part. There's just so many efforts. You're right, where people are raising funds. They're trying to donate masks. They're trying to donate PPEs. I mean, there's a whole PPE Guam group that's raising money for these supplies. So the public's definitely doing their part. Even in something as the neighborhood watches, we're doing our part there. We're remaining vigilant. So we're all kind of doing our part, and we're just waiting for the government to get on our level because, you know, we're killing that curve. We're staying home. We're following the orders. And it really seems like the people of Guam are working hard on this COVID, and it's just the government response is not really up there where we're at. But I mean, you know, hey, someone's got to do the work around here.
Yeah, I think the people should be applauded for what they've done.
Nobody said thank you. Instead, we're getting chewed out by the governor saying, you know, we think she has a magic wand and she's just going to wave all the problems away. But I mean, why don't you say thank you? Alakazam, Alakamalu, people of Guam, I just want to thank you.
I think people are more upset. Well, hey, you're alive.
How do you not thank us? I don't understand. How do you not thank us? How do you instead say that we should be grateful that we're alive because of you? It's really because of us. We stayed home.
I thank the people every day for staying home and staying strong. You know what I like to do, though, Chris? I don't think there should be people or the media should have to send any kind of freedom of information. And those are work, and it's tedious work to have to ask the government. The $117 million, what I'd like to see Adelup do is this. This is what we got, $117 million. Every dollar, every cent Here's the list of vendors. Here's the list of whoever is getting the money. List them down and publish that. Be transparent. Don't make the media get a Freedom of Information Act.
We only get 2 questions. Work with us here. Come on. Don't make us waste our questions on transparency.
117 million. List them down. And whatever Guam has expended since the time of declaration of emergency, list it down.
Good luck with that. You got to FOIA that, Doc. Yeah. So I don't know. Bree, there's some kind of reporting they're supposed to do to the legislature, right?
Well, I think at the end, when there's a declaration of emergency that's declared.
Well, I'm going to send a FOIA this morning, Doc. And I know other media have tried to ask, and, they're probably just going to drown you in a, alakazam, alakiments, let's drown you in a mountain of documents and charge you a penny each.
Whoa, dude.
It shouldn't be that way. A transparent government is a government that the people want. If a government cannot be transparent, how do you expect the people to follow you? Be transparent. That's my take on it.
I got you. Totally agree, Doc. Agree.
Yep, I agree.
Okay.
I wanted to ask you about the test results. There were a total of 84 test results that were returned over the weekend, and we had 0 cases of COVID-19. I wanted to get your take on it appears how well we're doing.
The virus has been on Guam, in my opinion, since April, or not April, since February. Way back in February. That's when I believe this virus came on board. Maybe even end of January. So it's been on Guam for a while. That's why the first case that came positive is already a community acquired. So that's evidence of community spread. Right from the get-go, from the first test is positive, community spread. So right there and there, we know it's already on Guam, okay? So the swiftness that we had to do with the lockdown, even though the governor, did a true lockdown or, short of that, a couple of weeks later, I think we've contained this virus enough that I think the positive is going to be on the lower side. So I think we've contained this virus here. The key here is to how to get out of it. I think I heard Michael Israel, and I think Michael Israel is singing my tune now too, because I've been saying it all the time, is that, hey, watch the hospitalization rate. It's been flat, which is good. And I commend the GMA staff for the ICU. Jolene Agan's done a wonderful job. And the ER staff, even urgent care, so I applaud them for that. So keep the hospitalizations low, but you have to watch the gates of the airport. If you're going to do any testing, test them at the airport, because that's where the virus is going to come in from. Locally, if you have some spread locally, as long as it's low, I think if you can keep hospitalization rate continue to be low, I think that's good. So I think we can start opening up certain businesses and then work with the community and how to live the way we're supposed to live now. Not 6 months ago.
Right.
Social distancing, continue mask on. And if you have a restaurant, if you have a capacity of 100 in a restaurant, you may want to start with 10, and take reservations, things like that, and then making sure that you sanitize and continue to wear masks.
Doc, I was wondering, because I was talking about this with some friends, when we open up the restaurants and we're going to do the social distancing 6 feet apart, I wonder who's going to have to wear the mask. Is it going to be the servers or the diners? Everybody. So what do you do? Like, you go like that when you're eating? Like,
everybody. You're going to have to separate them out.
I mean, these are questions that they're thinking of. Hey, but Doc, just keep a heads up, because we have heard that the governor's recovery plan is going to be announced today. That's what we've got from, pending. Everyone's got to run it through and approve it and everything. But I think that's going to be their announcement today, and it could be why they took the weekend off from addressing the public and the media.
Well, I think whatever plan they come up with, I hope it's a good one, and I hope it's
no
realistic.
Pressure, right?
Yeah, I hope it's realistic. Realistic meaning that don't give us these outrageous projections like 6,000 people is going to die, etc. Don't give it. There's no model that's going to fit. Now, if they refer to the federal government has said locally that you do what you can do locally, because the federal government does not know Guam. They don't know Georgia. They don't know Florida particularly. So they're going to base it on what you think locally is going to best fit your society, fit your community, and fit your businesses. Even with GHRA, our medical association is willing to work with them and see how we can, reopen these businesses on that side, because we all miss going out. We all miss going to restaurants. And I think the people have done a lot already. But we got to watch that second wave. Like I said, I think my interview at KUM, I was the first one to say, hey, these coming waves. If you look at some of the interviews that we did on the Zoom or Skype, it's coming waves. If you look back there, I said it way back. So the wave that's going to come, I think it's going to come from the airports. So you got to watch that. And the airport's going to go into community spread. So you got to watch that. I've always said testing should be done at the airport, GRMC, and GMH. So you got to watch that.
I wanted to follow up on something because this is something you also said weeks ago, and that was the movement of the maternity ward, pregnant women out of GMH into the non-COVID hospital at GRMC, and then we heard Lillian Posada saying that, you know, the priority is to get the adults, the Menumco, out of GMH into a non-COVID facility.
Right.
Have you heard any other discussion about this?
Well, you know, I kind of gave up on that a little bit because we've set up protocol now, and I got involved with that protocol, and I reviewed it. And I looked at the hospitalization rate at GMH, very low. If it stays low like that, you know, I think GMH maternity ward labor is going to be fine. But again, I told Chris before, sarcastically, that, hey, I know we're going to be okay because the women and children is still at GMH, and that remains true.
Right.
So from that standpoint, I think the government Guam, they can talk all they want about surges, about projections, 1,000 dead. They can talk about all they want. The mother and children are still at GMH. But reality is, I don't think there's going to be a COVID-free hospital in Guam. Naval Hospital is not a COVID-free hospital, and GRMC had 2 cases. So really, if you really think about it, I think we've got over the hump. And I agree with Peter Lombard when he said we think we got over the hump, and we communicate daily, we chat daily. But I think right now, let's not go knocking on the doors and trying to wake up this virus. Stay home, continue to do that if you're under the weather. Right. If you're really sick, call your doctor, get some advice.
Doc, what about what the governor had said last week about conducting 258 tests a day? Did I hear that correctly, Bree? Because
yeah, you know, when they
I
said
think
that,
I mean, it's making me question my own sanity, but I swear someone had said that we were going to conduct 258 tests a day last week.
Or that we would have the capability
Right,
to.
so
Yeah,
actually what had happened was Linda and the governor came out and said that we're going to do 258 tests a day, and then the next day Dr. Cabrera said, no, what they meant was we want to have the capacity to do, well, if we want to have the capacity to do 258 tests a day, why are we still only doing 47?
Yeah, you know, I think sometimes they just wing it. You know, I think they're not communicating well, and the messages coming out from the very start, it's always mixed. So that's why there's criticism.
Yeah,
there.
and I also think that goes back to what Dr. Shay, what you've been saying, is this transparency. Like, well, how many test kits do we have? How many of this? How many of that?
I'm just like, why would you tell us, the people of Guam, that you're going to test 258 people a day and then not do it?
Yeah, that's true.
I mean, it's kind of basic. I'm not calling anyone a liar, but you guys said you were going to test 258 people a day last week. Last week has come and gone. Was there any day last week where we tested 258 people a day? Was there?
No, but you know what I think is the reality here. Look at the military. I think they tested 4,000 to 5,000 sailors in 10 days, 10 to 14 days. They had the capacity, the capability, and I'm actually working on a letter to the Admiral today. I'll probably email the Admiral today and say, hey, sir, if we can get your help here because you've tested, congratulations. You moved swiftly, you've done it, you've tested 5,000 sailors within 2-week period. How about helping the island now? Because we've helped you accommodate your sailors, our United States servicemen, into our community. It's time. Don't wait for the governor to ask you, because I think the governor said, hey, if we need your help, we'll ask. Well, listen, you didn't ask, I'm going to ask.
Yeah.
I'm going to write a letter to the Admiral today, and I'm going to ask him, hey, help us test 5,000 people if you want to do that. Chris, the reality is here, okay? If you want to test 258 people, go to the hospital, go to the airports. If you're going to knock on doors, swab them at the door. Don't tell them to come back out and swab them. You know, do it right. I don't mind testing. I think testing is good. It's not a bad thing. But if you're going to waste the resources on that, don't have more people staffing your tents and less patients coming out to test. You know, that's not the way to do it.
Yeah, we got to capitalize. I mean, if we're gonna, be making a big deal about how we're so cozy with Admiral, and we did our part. We helped out with the TR. I really think that. I think with Admiral, it said that when basically, this is oversimplification. He said when it gets really bad, we're here as the backstop. And I think the line of thinking should be, let's try and get your help maybe before it gets really bad.
Yeah, come on, they tested it. Thousands of sailors here. If they have the capability to do that, this is war, right? We always say it, and I was the first one to say, hey, this is war.
Yeah, don't wait till we're losing the war to come in.
I'm like, I said that since the very beginning, back in February and early March, this is a war. And as people, if this is a war, then hey, let's get the military to help us out. And the admiral is a smart guy, okay? He's gonna always say, well, Gulf Guam didn't ask us to help you guys invest. You know, Gulf Guam is doing it yourself. It's great. And I read the letter from the admiral to the legislature. I don't know if you read it. Was dated April 23rd. The admiral wrote to the legislature and just said that, hey, you know, you guys are doing it already. Well, we need to ask him. Hey, give us 5,000 tests. You've done 5,000 for your sailors. Give us 5,000 tests for the community.
Yeah, and I think
that can be done.
I think that they should ask him at the press conference. I don't know. Either put him on the spot.
He's going to say, you know what he's going to say? Well, you didn't ask. You're doing it already.
Yeah.
Right?
Okay, Doc.
I'm not in charge.
You need a little magic wand, Doc?
Give him a little spell.
Let's give you a little spell, okay? Alakazam, Alakamalard.
I can tell you this, Chris. I don't believe those big surges, about thousands of deaths. I can tell you this, okay? A lot of my patients are getting pregnant again. So I can predict, come January, you're going to have a lot of babies. December, January, February. I can bet you that. The surge is going to come, and that's going to be
That's the surge you're talking about. Okay.
You're going to be extremely busy then.
Right, Doc. Okay.
All right.
Thank you, Dr. Shay.
Take care.
Wash your hands.
Of course.
Okay. There you go, Dr. Tom Shay. Always interesting to hear what he has to say, and he definitely has a lot of stuff to say.
Mm-hmm. And you know what? And now's the time I want to remind everybody that the government has moved into their expanded testing, and so anybody that is feeling sick, having these COVID symptoms, loss of taste, also loss of smell, you are urged to immediately contact your private physician and get tested. And if you don't have a private physician, you can always contact the Department of Public Health's community health centers. Call 311 and find out more information.
Yeah. 7:19. Let's take a little break, and we're coming back with Senator Clint Rogell to talk about his 2 cents on recovering Guam. It's 7:19, containing COVID. Good morning.
Be healthy. Be informed with ITD.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
To win this war against COVID-19, it's going to take all of us to do our part.
We are all frontliners in this epic battle.
And on Tuesday, May 5th, we're asking you to answer the call to help by taking part in Giving Tuesday Now.
It's part of a global initiative to set aside this one day for the pandemic crisis.
To step up and give a donation to any of our island's nonprofit organizations,
the hospital, the Mayor's Council of Guam, or any of our frontline workers. Whether it's PPEs, gloves, masks, canned goods, no donation is too small. Anything and everything will help.
And if you make your donation, take a picture, post it on social media, and use the hashtag GivingTuesdayNow and GivingTuesdayGuam.
And then later that night, make sure to tune in for our half-hour special Giving Tuesday Guam, Together We Give. We'll showcase how everyone is taking part.
Self-storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Hafade Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person in this community to stay home. COVID-19 cannot survive if we do not feed it, and that means staying home and washing our hands. Now, I know I've heard people my age in their mid-20s say, it's okay, we're young, we're healthy, we have strong immune systems, we could fight it. That's not true, and we also don't know who we could potentially be exposing. The only way that we can fight it is if we stay home. It is our duty to stop the spread and to stay home. Be safe, Guam.
Self-storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Specialist Joshua Mansonotia. I can't wait for him to come home. Keep us safe and stay home. I miss my daddy, and I can't wait to see him. So keep us safe and stay home!
Be healthy. Be informed with ITD.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc. Be healthy. Be informed with ITD.
Keeping you informed, KUAM News brings you Banking 671.
Take over Guam's favorite.
Representing Guam, USA. Raised on a hill in the Ville by the bay. Y to the O and to the is a. Me scooped out on the mic getting busy.
doesn't get any more classicer than that. Island Tribe, My Island. All the way local, 1000%. Good morning. That's all of our Facebook viewers, listeners, I-94 FM. Thank you so much. Of course, the audio stream at Docomo Channel 10. And 8 o'clock, we're flicking the big switch and jumping over to KUAM TV 11, 726. Let's get Dr. Hoa Wen of the Governor's Physicians Advisory Group. Good morning, Doc.
Good morning, Chris. Good morning, Sabrina.
Everything okay? I know you said you had a rough morning. Is that something we can talk about, or is it more on the...
No, it's on the patient side, so it's okay. So I'm taking care of that.
So I guess just first of all, what did you make? We had the pilot program this weekend. They made a big to-do about testing as many people as we could.
Well, I think the goal was 100. That was the sample size, and then it ended up being 52.
Yes, I mean, the pilot program, like I say, it's a pilot program. They learned a lot out of it, and we're going to talk about it on Tuesday. But, the turnout is not as expected to be. So they have to go back to the drawing board and see how we're going to approach this in a different way.
Why do you think the turnout was low?
I'm not quite sure, Sabrina. I mean, there's a lot of factors, and to let people know that there's the pilot program in that area. It's all about let the word out there for people to be aware of, ahead of time.
Well, they canvassed the area. They went door to door.
Yeah, but I mean, promotional-wise, you basically stood this thing up 2 days before you kicked it off.
Yeah, it's very hard. It's like when we go do medical mission in the Philippines, you have to have a very good promotional thing a week or two ahead of time.
Right. You need a jingle. You need some flyers. You need some ads.
2 days ahead, and you have to go door to door and knock at the door. It's not going to work. It's really have to be well planned ahead of time. So, like I said, it's a pilot, the first of its kind. So they're going to need to go back to the drawing board and see what's going on there. So they have to do better next time.
Do you think maybe perhaps people just weren't sick in the area? Because that was the requisite, right? You had to have these COVID-19 symptoms in order to get tested, and then they gave you a pass, right?
Well, they a little bit from input from yesterday meeting, but we didn't talk about this thing yesterday. But people are scared, and some people don't want to come out of the house, so and they don't want to go there to get tested. So and they do go door to door, but like I say, that's another one that we're going to try to figure it out, how to test them voluntarily. But people don't want to get out of the house because they're so scared. We got to approach it a different way somehow.
Well, Dr. Shay last week, he had mentioned why are we going out into the community and asking people to come out of their houses and come to the testing sites? Why, if you're going to go there anyway, why not do the test while you're there? Is that part of the discussions you guys had?
You mean do it at their house?
I guess Dr. Shay's saying, hey, you're already in their house. Why don't you just, hey, how do you feel? Hey, by the way, can I just swab you?
Yeah, it's the tech. You got to protect the healthcare worker due to swab them, and you can't really walk around full with PPE from one house to the next. It's very common. You don't wear your street clothes and go up and swab somebody or test someone. You kind of expose yourself. So, in order to do the testing, you got to protect yourself. So, like I said, the people that go door to door, they wear masks and gloves and everything, but they cannot wear the full PPE to do that.
Doc, so if we didn't really execute this pilot program as good as we could have, can we still have faith in the results?
The results there, we have to take what it is. So, all negative, which is excellent, So, like I said, we'd like to have more, so to give you a better picture of what the prevalence of the virus in the community. So we like to have it more, and like I said, they're going to go back to the drawing board and figure what's going on. No, we haven't have a meeting for this one yet. We will talk about it tomorrow.
Okay. Are you aware, because the numbers we got was the 52 that were tested, and these were only the ones that came through the drive-through and walk-in. Are you aware if anyone was fit into the category of like homebound?
I don't think so. I don't think so. I don't have the data from public health yet. Like I said, I'm going to ask, Dr. Montgomery to give a little bit of a talk tomorrow at the meeting, so we find out more, and we try to give her some input tomorrow, but not yet.
Let me ask you, Doc. So obviously, the governor is, I think she's putting out the recovery plan, what we hear today. But in doing that, she said that they would need some, I guess, milestones, for lack of a better word, like, 2 weeks of declining cases, or, a certain amount of time of zero positives. That being said, do you think that if we weren't to do any more community pilot program testing, that they could hold up this Estumbo and be like, oh, we're good, we did a little sample size, let's go ahead and reopen the island? Or do you think the prudent thing would be to maybe do some more outreach testing in some of these other locations that they've talked about?
Yeah, we don't want to have that resort and say, put our guard down and say that's enough to start to open things up. And she have a very tough decision there. And, we, like I said, we don't really know what the true prevalence here in the local community yet. So, we have to set some milestones to before we open some business, and we're going to open, I think, in phase. So we review the plan and give some comment yesterday, and she will review it, and then she makes a decision from there. But everyone want to be open. We want everyone to be open, but we got to do in stage with some caution. We don't want this thing to come back again at the second wave.
Right. So I just did the math here. The number of people that we've tested, at least on our side, is 1,387.
Yeah, our 160,000 people in Guam, so it's not the true representative of what's going on out there.
So you say even though we've been getting these zero positives, there was a couple cases over the last week, we've now got, the whatever, how many zero positives is still, but you're saying even with all that, we still don't know how prevalent the spread of COVID is on Guam.
I think just like a week or two ago, and I say, this past weekend is kind of a marker for me at least, because the 2 weeks ago is the Easter weekend, right?
Right.
So, and we don't see that much of a surge. I'm still waiting for some lab tests to come back from some testing we did last week, and if the majority of those are negative, then God bless, we are doing very good, and then she can look at those data and then make up her mind of what business and when to open, right? But we don't see that big surge after 2 weeks of Easter. So I think Guam, we are in very good shape. We just don't want to look at it and say, hey, we're in good shape, let's put everything back to normal, and then we might get ourselves in trouble again. Like I said, we might, so we have to be cautious on it.
Last week there was a full push to discuss the new expanded phase of testing where people who are feeling sick or have COVID symptoms need to get tested immediately. Have you seen any sort of increase in people that have been wanting to come in to any of the clinics or anything like that, or calls?
We're going to get updates in the clinic status tomorrow, but as of AMC, we test more this past 3 to 4 days than before. So we send most of our tests to DOS lab. So those they run locally. So we're gonna get the results sometime this week, and let's see how the number go.
Mm-hmm. I did want to ask you about something, because there's an incident that happened at the speaker's office, and it was with regard to an employee. According to their press release, the employee's physician let this person know that they had tested positive, but then the results, or presumably tested positive, they had to send the results to Hawaii for confirmation, even after the physician had said that the employee had tested positive. Is that typically how it goes, that a doctor can say, oh, you tested positive, and then, well, you got to go get tested again, and it has to be sent to DLS?
No. It's once you're presumably positive, DOS take the extra step and send it to Hawaii for confirmation. But when you're presumably positive, most likely you'll be positive.
Okay.
They have to take precaution even before the confirmation test, just to make sure that they prepare themselves, to make sure that they don't, because their office, they handle lots of paperwork and a lot of business from other people come in and out, and they had to take precaution ahead of time before the confirmation test comes back, in order to try to prevent spreading the virus. Most of the time, presumably positive, they're going to be positive. There's no question
And
about
so,
it.
Doc, can you just give us a little behind the scenes on that? When you say presumably positive and then a probable case, what type of examination does the doctor perform on the patient to reach that determination?
That's from the test-wise, Chris. It's not for examination. When the patient comes in complaining of certain symptom, and then the physician will decide to test and not to test.
Okay.
And so it's not through the exam, it's through mostly from the symptom, and when you talk to patients or vital signs, and they decide to test. And like I said, presuming positive mean that, like I say, you got to take precautions, and when the test come back, hopefully today, we should know today or tomorrow is confirmed, and most likely it will be confirmed. But like I say, the speaker have to take action before that, just to make sure that everyone's safe.
I just got a message from her chief of staff. He says, because we were trying to get her to call in this morning, he says, the speaker wants everyone to get tested first. Her main priority is the health of our staff, and we are all on our way to get tested now.
Yes. So that's the right thing to do. Okay.
So presumably positive, are they classified as PUIs for now? Is that
right now, I don't think they count as positive yet.
no, but are they counted as PUIs?
Yes.
That's what they would be classified as.
So the person will be quarantined at home, and until this test coming back through Hawaii. But right now, the person stay at home.
Does anybody keep account on PUIs?
I'm not quite sure. They keep account PUI, but if the patient come in and complain of some symptom and you test them, it will be we'll say that's a PUI. A lot of people that come in because they have come in contact with them and don't have any symptoms, I don't think they count as PUI. But so you can say PUI, so everyone that turned positive, and some negative, but I don't think they count them.
Doc, I know you'd been saying that 2 weeks after Easter was going to be a kind of a gauge to see where we're at. But I'm wondering, outside of the pilot program at Estumbo, how much testing for COVID do you think was done over this maybe Friday, Saturday?
I'm not sure. Our clinic, I said, we swapped on Saturday about 20 plus on Saturday. So I'm not sure what the other clinic are doing. I mean, it's open now to own a clinic now. I mean, there's a word out there that anyone that likes to test, they can call the physician, and if the physician office determination to see is that they want to do at their clinic or they want to refer to a tier 2. Some clinics, either their office space or whatever reason is not, if they deem not safe to do it, then they won't do it. It's they have the ability to do that, protect their staff. So if the clinic feel that they cannot do safely, then they will refer to other site to do the testing.
We had a comment here. I mean, I've seen this a few times, but they were saying testing done on a hot day like that. Are we at all concerned about the integrity of the samples, or do they kind of have that covered?
No, that type of COVID, because once you test it goes straight into the valve, so it's not exposed to the air very long. You know, you don't walk around with that swab. You put inside the valve right away.
Okay.
And it's really depend on you got to do the test correctly too. You know, I mean, that's where I don't know is it's really based on the skill of the person to do the testing.
Right. Doc, we had you on last week, and there's a comment from Vivian. It says, Doc Hoa, you said the test is free, but Linda DeNorsi says it's not free. How can you explain that? Times are hard. People do not have the money to pay to get tested. Plus, a lot of us no longer have medical insurance to cover for the tests or to get maintenance checkups.
I'm not quite sure. I think they misunderstand Linda. I tell you 100%. Nobody should charge for testing. 100%. I mean, that should totally be free to the patient. I think they misunderstand Linda. That the tests are free. You know, if the patient pays $0 for testing. If the patient has to pay something, they gotta call in and tell us what site they go to, who they go to. But I tell you, they should charge $0 for testing.
So if I needed to go to the doctor and I requested testing, I wouldn't have to pay?
$0, Sabrina. You pay nothing. Yeah, even your insurance, your copay is $0.
Mm-hmm.
You know, you come out of the office or anywhere, you shouldn't spend 1 penny on it.
Okay.
Is that just because Dr. Hoa says, or is that what is written down?
No. That is something that the advisory board are very firm on it. Nobody.
Alakazam, Alakari, all COVID-19 tests are free.
Yeah. I tell you, and if the patient gets charged, please let us know. I mean, they should not get charged at all. I mean, the tests are, they shouldn't cost anything when to do this thing. It's a community thing. It's not like, you get sick because something. This is involves everybody.
It's a public health emergency. I got it.
Yeah, I'm very sure that they misunderstand Linda regarding to pay for the testing.
Doc, there was another comment here from what I was told from a person who was tested. It hurts due to swab being inserted far into your nasal cavity. Is there a possibility that the test wasn't given correctly? Just asking.
No, the test is not comfortable, guys. I mean, it's uncomfortable. I apologize ahead of time to everybody that I'm going to test.
Right.
Because it's not comfortable. You have to go pretty far up there to get the test done. And, I wish there's other way. There's other way, the saliva test, but it's not really very widely available yet, But no, it's not a very, very comfortable test. So if you don't feel nothing, that means they didn't go far enough up there.
Oh, so like up to your eyeballs or something.
Yeah, it hurts. I got swabbed over at AMC in McGeelow for some B-roll. This is kind of like a few weeks ago. So Nurse Francis had given me a swab, and it did not feel good. So yes, they're doing it right.
Is it both nostrils?
No, it's just the one.
Just one.
But they go way up into the gold mine.
For this one, you gotta do both.
Yeah.
Oh, you do?
Oh, you gotta do both. Ow.
Yeah, you gotta do both for this one, Chris. Yeah. Guys.
But it's not like a prostate or nothing like that. It's just a little sticking in there.
Yeah, it's kind of hard. It's not painful. It's just uncomfortable, and you feel like you go up your brain or somewhere. But
when you get punched in the nose and you kind of get that little tearing up a little bit, it's almost like that.
Never got punched in the nose.
Yeah,
Lucky you.
Okay. But again, guys, it's free. Okay, it doesn't cost anything.
Okay, Doc.
Okay.
So how you feeling though, Doc, about this? I mean, because people are just over the weekend. I went out. I drove around. I wanted to take my kids to the beach for a little mental and physical exercise. Pulled up at the beach. There were canopies set up. There were people gathering. There were about 20 to 30 cars. And this is a little beach. So I think people are hearing, and they're putting it together that the governor's talking about recovery. We're getting zero positives. So people, I feel like, are just letting their guard down. I'm not, though. I'm not. Yeah. We're not.
And that's what we are very cautiously put a message out there. Please, still practice social distancing. wear your mask and if you really love your loved one, you have to take precaution because, all we need is one, and you might lose your loved one. And, you gotta be cautious. This one, we see the number going down, but the new norm, just like the recovery phase, everything gonna be different. The social distancing is very important. The mask use is very important. So, we know that the disease spread by cluster, mean that group of people get together. I mean, it's not really something that require rock scientists to do this thing. It's all documented. So anytime that you have gather 20, 30 people, you barbecue together, there's a possibility one of the person that has no symptom or carry the virus is going to hurt your loved one. So be careful. You need to exercise cautiously and not let your guard down.
Thank you, Doc, for saying that.
Yeah. Okay.
All right. Appreciate it.
Can you also just before we mute you, can you just make sure it's absolutely clear that you are not prescribing Clorox pills or Lysol shots?
Yeah, can we just get a comment on that about ingesting disinfectants? It's wrong, right? Don't do it.
It's totally wrong. I think President Trump. I think he feel bad about it. It's just truly. You cannot do that. Those are excellent use, and even external use is really cautious use, but do not drink any Clorox or Lysol or inject anything, because I tell you, those things are very caustic, and you can die from it, so please don't do that. Yeah.
All right.
But if you die from it, you won't get COVID, so.
True.
I mean, I don't even know what world we're living in, Doc.
We're just kidding.
Yeah. Yeah,
Bree was like, "Hey, you want a little Lysol in that coffee? Just a little hit."
It's good, but seriously, the new norm going forward probably the use of masks. It's the new norm for a long, long time. And what happened is that what we are afraid is that during the flu season we're coming up in September, October, and that this might come back along with the flu.
Mm-hmm.
So that's what we're afraid of.
Okay. Well, thank you so much. As always, it's a pleasure to hear from you.
Right. Appreciate it, Doc. Wash your hands, Kay.
Okay. Stay safe, guys.
Yeah, we will. Okay.
Have a good morning.
There you go. Dr. Hoa from the AMC family of clinics. He's also on the Governor's Physicians Advisory Board. And the important word coming out from Dr. Hoa, who is definitely on the front lines of this, do not let your guard down. Okay, like you said, it just takes one. And I understand someone had commented something what I was talking about, the beach. They say that when you call 311, they encourage people to take your family out to the beach, but to practice social distancing. The problem with that is if everybody goes to the beach, how are we going to practice social distancing? Which is, my kids were disappointed because we live a little bit down from the beach. And yesterday I was like, let's go get some sun. Let's go put on your swimming trunks, and we might not swim if there's people there, but we're definitely going to go and take a walk and just get out of the house, right? I pulled out. I was driving to the beach. I just couldn't believe there was I swear to God, there were 30 cars on the main road. Mm-hmm. Like I said, there was 2 canopies here. There was 1 canopy here. There was a family over here. There was another family over here with a canopy. People were swimming. It was actually more crowded than it is usually before the COVID.
Wow. I miss the beach. I don't go.
Did you even go to the beach before this?
Yeah, I did every once in a while,
Yeah.
But
I miss it too.
I would like to go, but I'm, me. I just home and work.
Right, I know, and so that's why it's important to kind of get out of the house, but not if we're all going to do it at the same time.
Can I just jump in? Can I ask you guys? Remember there was that very popular video, Chris, when we were in middle school, I think even in high school, the Scared Straight program that would teach.
They need that, the COVID edition.
No, seriously,
Yeah.
and I tell people, because some people, they'll message me or they'll ask me, is it really that bad? And can I go out? And do I really have to stay 6 feet? I was like, you want motivation to actually stay home and do the right thing? Just go on YouTube for 5 minutes and look up a COVID video and some of the symptoms and what it can possibly do to you. If that doesn't scare you to stay home, then,
Yeah.
because it is not pretty, as the doctor was saying.
I mean, it's difficult. It's difficult for people in their minds to kind of process that this is still a major threat, because we're having this huge conversation about reopening the island and, trying to do more testing. But just remember, guys, the government is saying that we can't reopen the island unless we do a lot of testing. Mm-hmm. We're not doing a lot of testing. So, I mean, like Dr. Cabrera said, what was that? Discussions are not decisions. So they aren't talking about reopening the island. They're going to come out with their plan, but at the same time, you still need to stay home and go to the doctor if you're sick, get tested.
I think, to be fair though, like a lot of people that have lived on Guam their entire lives, they approach this crisis as if it were almost like, and we talked about this when we first started the show, 6 weeks ago, and we said this isn't like a typhoon. People typically get ready because that's like the biggest thing that happens. But when we do have a typhoon, people say, okay, hunker down, get all your stuff together, square your house away, and then take 2, maybe 3 days and, get everything ready. And then when the winds start to die down and it doesn't rain anymore, then you generally know things are more or less like back to normal. This isn't the case. This is something that we have never seen before in human history. And it's going to take each and every one of us to not be selfish and to work together. This isn't, somebody else's problem. This isn't just underprivileged people or financially strained people or the elderly. And this is each and every one of us.
Right.
Around the world.
For us, though, in a sense, it is kind of like a typhoon in terms of how we work and how we plan. We know that this is an emergency situation, that information needs to get out. No, I didn't think that this was going to be like a 2-week deal. I knew that, we have to continue working, have to continue to get the information out, no matter how long it takes.
Yeah.
And so we're not out of the clear. It's like we're still need to be on guard.
Uh-huh.
So wear your mask, stay home, only go out if you need to get essentials, and get tested.
I mean, maybe to reinforce what Dr. Hoa was saying is like, I've said so many times to like people, and they were like, maybe I'll just go out, or I'm gonna go and stand in line at like a restaurant and just like get something and everything, and I'll bring my kids with me because they need to like stretch. I was like, are you willing to bet their lives on that?
Yeah, my son has not left the house,
and it's a harrowing statement to make and everything, but it's like
no. I mean, going to Payless and, going grocery shopping, I just kind of do that myself. I don't bring the kids down because they're wild. I mean, sorry, anybody got wild kids out there? I'm that parent, you're like, God, I wish these people would control their kids in the store. So, sorry, was that a bit much?
No.
Okay. Yeah, so I keep them home. I mean, we take it serious. We wanted to go to the beach for a little bit, but the minute I saw everybody was at the beach, I was like, oh, no, and I kind of got mad about it. I put some stuff on my Instagram, and I was kind of just mad because this is why they want to curfew us. This is why they want to give a ticket, because, people don't take it serious. But again, like I said, I kind of understand why they're thinking it's okay to let the guard down. That's why it's important for us to get these voices like Dr. Hoa to come on and say, no, we're taking it serious, okay? All right.
Just be patient. Hang in there.
And so we're going to get Senator Biscoe Lee. This is a really interesting development in that we know that the government of Guam had got over $100 million. $100 million in the bank, sitting in the bank somewhere, gathering interest. And, just as recently as Thursday, Friday, we had asked the governor, hey, people thought they were going to be getting their federal aid now. It's not going to happen. Unemployment, I mean, God help us, they're saying weeks to a month away. Federal stimulus checks for everybody who doesn't make under $10,000 a year, weeks away, So Senator Biscoe Lee had written a letter to the governor, and this was based on some guidelines that came out from the federal government themselves on what the local government could possibly spend this money on.
Did you want me to go through
Yeah,
this?
that was supposed
to. It's a long
I mean,
list.
just, the points. That's why I was like, we're supposed to be this money on, and then it's like, and then you come in and you're like, and what they could spend the money on.
Oh, goodness. It's
Alakazam, Alakazoo, tell us what they can spend the money on for me and you.
All right, so it can cover costs that are necessary expenditures incurred due to the public health emergency with respect to COVID, were not accounted for in the budget most recently approved as of March 27th, which is the date that the CARES Act went into effect, and were incurred during the period that begins on March 1st and ends on December 30th of 2020. So it actually is a lot where the governor can actually use the money Eligible expenditures include, but are not limited to, the payment for medical expenses, such as COVID-19 related expenses of public hospitals, clinics, and similar facilities, expenses of establishing temporary public medical facilities, and other measures to increase COVID-19 treatment capacity, including related construction costs, testing, including serological testing, emergency medical response expenses, including emergency medical transportation related to COVID, expenses for establishing and operating public telemedicine capabilities, public health expenses for communication and enforcement by state, territorial, local, and tribal governments of public health orders, expenses for acquisition and distribution of medical and protective supplies, expenses for disinfection of public areas and other facilities such as nursing homes, expenses for technical assistance to local authorities or other entities on mitigation of COVID-19, public safety measures, expenses for quarantining individuals, payroll expenses for public safety, public health, healthcare, human services, and similar employees whose services are substantially dedicated to mitigating or responding to the COVID-19 public health emergency, expenses of actions to facilitate compliance with COVID-19 public health measures, such as expenses for food delivery to residents, including, for example, senior citizens and other vulnerable populations, to enable compliance with COVID-19 public health precautions, expenses to facilitate distance learning, including technological improvements in connection with school closings to enable...
So that means, what I take that to mean is that they could give out free Wi-Fi for families who don't have it, so they could do the distance learning. I mean, you know, I'm not a lawyer, but kind of sounds like that.
Expenses to improve telework capabilities for public employees, providing paid sick and paid family and medical leave to public employees.
So it kind of sounds like they could use this money that we have, this, how much is it, 117?
I think, yeah, it's over 100 million.
Yeah, so I mean, I'm just kind of wondering, before the governor had said, we don't have the money, go apply for food stamps, hang in there. What do we say now, today? Because we have the money.
Mm-hmm.
We have $117 million. Uncle Sam said you can use it to provide financial assistance. You could use it to feed people.
It's a lot here.
So I'm just thinking that if there's a press conference today, that their recovery plan reveal might get rained on by people asking about, hey, so now that Senator Biscoe Lee has come out and the Department of Treasury came out and said, yeah, you can use this money to help people in the meantime.
For homeless populations, state prisons, jails.
So I wonder what the response is going to be. Is she going to get
grants to small businesses?
Is it going to be like a defensive kind of response, or is she finally just going to...
Unemployment insurance costs?
Right, yeah. So obviously, I mean, the money's there, and it can be used to help you guys.
You know, and one of the things that Senator Biscoe Lee put in her letter was the fact that it doesn't appear that legislation is needed.
Right.
This is something that the governor can do. And if, in fact, she does need or feels that she needs legislation, then, you know, the legislature is ready to get to work.
I mean, in a perfect world, if I'm out of loop, knowing that they need a big W after that L they took on the governor's response to a imaginary meme, I would have come out and said, hey, we got the money, we're gonna work something out. But, you know, we ain't at out of loop, so we'll see what the response is. Hey, it's 7:59. Remember, at 8 o'clock, we're going to jump over and flick the big switch for KUAM TV 11. On the way, we're going to hear from a bunch of your senators. Clint Rogell, his 2 cents on the recovery plan, which we're understanding is probably going to be revealed today. And from what...
I wonder if any of the senators got a chance to even look or review the recovery plan, you know, in the event that there may need to be legislation.
Speaker Barnes had said that Senator Joseph Augustine was involved with it. So, you know, we've had a hard time getting a hold of Senator Joseph Augustine. I mean, we could try again, but yeah, not really the kind of guy to call up. So it's 7:59. We are KUAM FM in Hagåtña, Guam. Again, we're flicking the big switch and jumping over to KUAM TV 11 in... Do I need the wand for this, guys, or we're good? We need the... Okay, here we go. Alakazam, Alaka Heaven. Please come and watch us on KUAM TV 11.
Be healthy. Be informed with ITD.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
sounds good. Some sardines for breakfast.
Oh, those are good as like a taco.
Yeah.
Or even remember when? What was her name? She used to bring in the sardine empanada.
Yeah, Crystal. That's from for Lent.
Gosh,
right.
So good.
Man, we lost Lent, dude. Lent was like Easter.
Yeah.
Your birthday. 420.
Jason's birthday.
Jason's birthday. Oh yeah, Jason's birthday.
Girlfriend.
Possibly Cinco de Mayo. Wait and see. It's 8:06.
Cinco de Mayo, isn't that the day?
That's the day.
That's the day.
But we don't know if it's going to be the day because there was an announcement made last week that it was possibly going to be extended, which we haven't yet to confirm. So,
well, I think there's going to be the announcement with the announcement on the recovery.
There's going to be some announcements made today. In other words, at the press conference.
Okay.
So we're anticipating that the recovery plan will be revealed, but also really kind of interested in what has become like a kind of different back and forth between Senator Biscoe Lee and the administration. Routinely she's kind of been that one who they call to get votes and whatever they need, and she's there. But she had her rise.
Yeah, her rise.
This was exactly what we've been talking about, which is local assistance to bridge people while they wait for the federal monies. But then the governor said, no, scrap that. We're going to pay out advanced stimulus checks to those who earned under $10,000 in tax year 2018. And so she did that. She tabled the measure.
Mm-hmm.
But now she wrote a letter to the governor basically saying, hey, you got this $117 million. All the guidance from Treasury says you could use it for this, and this. What are we waiting for? So I'm pretty sure that's going to be something. I noticed that when we have one of these senators who come out with an idea, one of the common ad-lib tactics is for them to come out with their own idea and then, ram it in the legislature and get their people to run it up the flagpole. So I'm curious what's going to happen. I think it's going to be a big news day. Let's just put it that way. And let's go over to the phones here. We got our deep dive into COVID-19 news, but we wanted to get Senator Democrat Clint Rogell on to talk about a Facebook post that he had about recovery. And this was quite a lengthy one, Senator. I don't know if we have the time to read the whole thing, so we just wanted to get you on to kind of talk about ahead of the governor's release of her plan. Mm-hmm. What are your 2 cents on recovering? Senator Clint Rogell, good morning.
Good morning.
Hi, good morning. Yeah, so I think we do need to start thinking about how do we recover. And I said this during session the other week when we were voting on, the bills that would have allowed, when we were talking about the 2 bills, the curfew bill and the other bill that would have allowed for penalties for violating the executive order. I basically said that, I don't think the executive order or the curfew is necessary at this time because I think we're doing good in containing COVID. And I think now's the time to start sort of switching gears and thinking about how we can reopen the island, but not immediately. We have to reopen in phases, and that's a lot of what my post was kind of talking about. And this is because this is my take on it after doing there's a lot of my own research and looking at what's happening in other countries and the countries who have successfully contained COVID and what they're doing and how they're handling it. And a lot of those countries are Asian countries. I'm talking about Taiwan, Hong Kong, South Korea, Japan, Singapore. Those countries, none of them have really done full-on lockdowns. Each country's kind of done it differently, to different degrees. But for the most part, those countries haven't really done any real lockdowns. They'll do some social distancing here and there, and they sort of, if they see a spike somewhere, then they start clamping down a little bit, right? And then other than that, they're letting a lot of their operations run, pretty open compared to the rest of the world. I have a friend in South Korea right now saying that they've never really been on lockdown ever. They just kind of, certain areas here and there, they will close and say, okay, maybe you guys shouldn't have this open. I read some articles where in Japan and South Korea, they've got karaoke bars open. And I believe in South Korea, there was a little bit of an outbreak that it started making a comeback, and they traced it to karaoke bars because too many people were hanging out in karaoke bars, some people were sick. And there's a lot of evidence showing that singing and loud talking helps to spread the disease because it causes you to aerosolize the virus.
Right,
Basically,
The
you're
droplets.
sending the virus into little aerosol droplets when you're yelling or you're singing, and then that causes it to float around in the air and infect other people. So they were tracing some little spikes in areas in South Korea where there were people. It was coming from karaoke establishments. People were still. And so when I read that article, I was just like, wow, these guys are still, they got karaoke bars open and stuff. They're leaving a lot of different things open. So just in looking at all these different countries and what they're doing, a lot of it is, of course, testing is a major factor.
Right.
You got to make sure that the testing is on point. But also, and contact tracing is a big part of it. So I kind of, in the post I posted to Facebook, I think that's what you're referring to, right? I sort of laid out some things that I think we need to do going forward. And of course, that's improve our testing and expand it. And of course, they're working on doing that. That's why they did the pilot project this weekend. Of course, we're going to have to hammer out some more details and make sure they get it right. But I think it's a good start. So I think if we can increase testing, we can get better data and see where our numbers actually lie.
How much more testing center do you think we need to do before you guys can reasonably say, all right, we know where we're at with COVID, let's start opening up stuff?
Well, I mean, I can't say. That's really that's something for experts to figure out. I'm not a medical expert. I'm not a mathematician. That's where you need a medical expert and a statistician really to figure out what do these numbers mean. I've done some of my own tracking, but like I said, I'm not a statistician. But from what I've seen, I've done a lot of with my own tracking is I look a lot at what are the percentages based on the batches, right? So, for example, you can sort of see. Basically, I've been tracking the numbers myself personally, kind of like a madman over here, because I'm just trying to get an understanding.
You're like the Peter Lombard of the Guam legislature, maybe.
In a way, I came to a lot of the same findings Peter Lombard did, and it was just based on. But mine was very simple, rudimentary math. It wasn't as detailed as Lombard's. So, but what I was looking at was, I'm looking for patterns, I'm looking for anomalies, and So the first thing I did is I started trying to figure out patterns, right? So the first patterns I noticed, I started figuring out, okay, whenever we test, say, 30-some people, we would normally get X number of people positive, right? Or when we would have a batch of 20, you would see X number of people positive out of 20. So that kind of gave me like a baseline to figure out. And you could see it too. You could see it increasing when I think we were closer to our peak. I'll give an example, like I would say like when it was, when we're kind of seeing like what I would consider our peak, say they would test 20 people, they could easily find 3 positives out of 20 or 4 positives out of 20 even. And now when they're testing 20, it's either 0 or 1. I mean, the other day there was 1, but for the most part, there's been a lot of zeros. When we were testing in the high 30s to low 40s, you would see anywhere from a range of like 3 to 6 positives in those batches. Now we're seeing zeros. So that's what I'm looking at. I mean, I'm kind of basing it off of that. So if you see that, and actually you could see the numbers going down over time. So if you see that going down over time, that shows that we're heading in the right direction. And also you look at the hospitalizations. I think there was a report that I think there's only 1 person in the hospital due to COVID right now. If we were really on track the way it was looking in the beginning, our hospitals should be like bursting at the seams by now. And that's what a lot of the thoughts were, that by, sort of by the end of April, around May, we'll start seeing these huge surges at the hospital. We're not seeing it. It went in reverse, actually. Now there's less people in the hospital due to COVID-19. So I think those are all strong indicators that we're doing a good job of controlling it. So with that, I think now is the time to start looking at how do we reopen. Now, that doesn't mean reopen right away. I think, so to sort of put it simply, the type of reopening I'm envisioning, it would have to be something, it's like taking baby steps, right? So you got to take one little baby step forward. You sort of peek around the wall a little bit, take a baby step forward, make sure the coast is clear, and then there has to be a waiting period. And the reason there has to be a waiting period is you got to wait and see what the effects were of that baby step.
Yeah.
So you sort of take that baby step forward, and whatever it is, that's what the that's what the governor's team is going to have to figure out. And I'm sure that's what they're working on now.
Right.
Now, I heard you guys say that maybe some senators have seen it. I'll be clear. I haven't seen it. I have no idea what they're working on.
Okay.
Do you feel that you should be privy to it as a member of the...
I would like to, but I mean, they've got their own team sort of working on it, and I don't know how much I would have been able to add to it. I sure would have. I'm willing to help if need be, but I mean, should I see an advanced copy of it? Is that what you're saying? Or,
yeah.
You know.
Yeah, I mean, you guys are kind of like a branch of government.
I mean, sure, but I don't know if there's an advanced copy available yet.
Right.
I think there's still. I mean, things are happening very quickly.
It's rapidly evolving. Say it.
Yeah. I mean, it is. That's the truth. I mean, the whole world is rapidly evolving. The whole world comes out and says one thing, and then each country will do one thing and then change their mind, and then wait,
Right,
that's not working. We got to do this. I mean, this is a brand new virus, and I think that's one thing people forget is that the whole world is grappling with this thing. And I kind of said it early on in the beginning. I think when I was on your guys' show, I said this is something that's new to the whole world. You got the leading scientists around the world will put out a report and then say, wait a minute, actually, we're a little bit wrong with that.
Right.
I mean, you have manufacturers making tests and then saying, wait a minute, that test is bad. The CDC rolled out a batch of tests and then recalled them. That was the first batch of tests. This is the CDC. This is our leading experts from the U.S. They rolled out batches of tests and said, wait a minute, those tests are bad, and recalled them, and then had to put out another batch of tests, which is another reason why we're behind in testing, and the whole nation is behind in testing. You got people screaming at the president to do more tests, and the president's saying it's fine, it's perfect. Everyone who wants to get tested can get tested. And then it turns out he's wrong. Not everyone who wants to get tested can get tested. You've got manufacturers like that Abbott company where rolling out tests and then coming back later and then saying, oh, wait a minute, don't put it in the vial of the serum or whatever.
Right,
That's
yeah.
diluted. Yeah, we just figured that out now.
Right.
So things are changing constantly, and it's because this is something that's brand new that the world has never really dealt with in this way before.
Right.
In the whole way.
What about your baby steps, Senator? Let's just fast forward to you talk about opening in baby steps. What would be the first baby step that you would take?
Well, I mean, for me personally, I don't know. That would be just, this really requires a lot of serious thinking and sitting down with people. So I couldn't say for sure exactly. You need all the experts. You need to have all the medical experts there. You need to have the statisticians there and the medical experts, and just to figure it out. But it's whatever they have to set it somewhere. I would say start conservatively. I would say start with a few things that limit as much as possible human-to-human contact. I would say start out with things like that. Now, what exactly does that mean? I don't know. I'd have to look at all the different sectors of the economy.
But do you think it's something they could whip together in a weekend?
Maybe in a week if you have the right experts. If you have the right experts around, you can figure it out in about a week. I mean, and then adjust it as we go. So that's what's going to require. It's going to require a lot of adjusting as you go. So the idea is you take a baby step forward. You wait and see. Now, how long do you wait? Again, that's up to the medical experts.
Right.
Now, I would say a minimum 2 weeks, only because they talk about the incubation period could be 14 days, right? Whatever before symptoms present. So I would start there, maybe a minimum 2 weeks, but I think probably a month would probably be even safer, right? So take the first baby step, wait 2 weeks to a month.
But then also,
the numbers.
On the government side, the testing capability would have to be there. If we're going to take a baby step and then we're going to watch and see if there's any ripple effect as far as like COVID or COVID exposure, then it also has to be coupled with the government going in and, getting really serious about testing people.
Well, I mean, that's what Dr. Felix Cabrera said, that a big chunk of the decision to reopen and how we're going to reopen is based on our testing capacity. And by increasing testing, then it gives the decision makers a better idea just how widespread COVID is. But, as we saw over the weekend, there was a total of 84.
Right. Not 258, right? Is 84 258 a day? Because I'm not good at math.
Yeah, no. I mean, I saw some reports that they wanted to do 200 a day.
Right.
So that would be a good start. If we could get like 200 tests a day. But it sounds like it's difficult because there's people just not showing up to get tested. So I don't know what the details are behind that, but I mean, I imagine some people are probably scared to get tested.
Sure.
I've been dealing with people, messaging and commenting I think there's some fear out there that if you get tested, you'll get yanked from your home and thrown in like quarantine jail.
I mean, it's really the words they're using, Senator. I mean, yanked from your home.
Yeah, it's a misunderstanding. So I actually clarified that. I actually spoke to the communications department at Adelup because people were asking me, and I clarified it. No, what they were referring to is
Did you get 2 questions or more?
Did they mute you or?
No, I sent a message.
Oh, okay.
See, you got to email your question.
That's it, right
so
on.
I sent a message over WhatsApp and then I got a response. So what happened was basically it's a multi-generational thing. So my home is a prime example, right? So my parents live with me. It's like me, my wife, my kids, and my parents. Say I test positive, and my house is too small for me to really be able to isolate myself. And I think public health looks at a couple things. I've spoken to people at public health in the past before that said one of the things they look at is sort of like, can that individual isolate themselves within the home? In other words, does that individual have their own room that's separate from the rest of the people? Is the house big enough, basically? Does that individual have his or her own restroom is a big thing, too, that they can use that the rest of the house doesn't need to use? And those types of things they look at. So in that case, I would have to be put elsewhere. I would volunteer myself if I testify. I'd say, get me out. My house is too small. There's no way I'm going to avoid my family, my parents, if I test positive. I would actually be begging them, you got to stick me somewhere else because there's no way I can avoid them with the way our house is set up. So that's the type of thing they're looking at, and that's where they're talking about putting someone into a facility. And you're right, maybe it is a poor word choice to say like yank from the home.
Well, we're not saying that. We've been very consistent with our message from public health, but there's media out there just irresponsible, really, the way they're going to present that. And, I mean, it's a public health emergency. We want to encourage people to go out and test them, not use, fear tactics because you're partisan. It's ridiculous.
And I know that they're allowing that because I can say with confidence, I know specifically of an individual who tested positive, who was left in his home, and he had 2 people living with him, and it's because they actually went out and they assessed the home and they said, okay, your home is such that you use this restroom, you stay in your room, and you guys stay away from him, and you'll be fine. And he's fine, and none of the 2 people that live with him, roommates, neither of them got it. They all tested negative.
Right. Yeah.
And the guy who was positive, he's now negative and he's totally recovered and everything. So you can do it, and I know specifically of an individual where they did do it that way. So that's why they're not going to be just yanking everyone and throwing them in a quarantine jail
isolation facility. Right, yeah.
Yeah. So I guess back with the baby steps kind of thing, right? So I think you take that baby step, you wait 2 weeks to a month, and you see where the numbers are. And you're right, we're going to need some more testing to be certain. But at the same time, we can still glean a lot of information, even just with the level of testing we've done now. Say if they keep that testing, you can still see a spike. Because if you're testing in those batches, like I said, you can take a look. Out of 20 people, how many were positive? All right, normally out of 20 people, how many have been testing positive? You take a look at 37 people and you say, all right, how many tested positive today? Okay, normally out of a batch of 37, how many are testing positive normally prior to whatever baby step we took, right? And then that's where you can see the spike. And if you see any spike right away, then you take that baby step back and you just go right back behind the wall. You reassess everything, and then you probably have to come up with a new baby step or something else that won't evoke that same response. Because what's happened in some other countries is they have opened up a little too much. There's a prefecture in Japan, I think in Hokkaido, if I'm not mistaken. There's some articles now showing that they opened up and they relaxed too much. They had some weekend where they had people were out partying and they're on the streets and filling the cafes. And on top of that, they had people from other areas within Japan that were infected, were flocking to Hokkaido because they heard that the restrictions were opened in the Hokkaido. So other places where it was more restrictive, people were going there, probably to get away and have fun.
Right.
They brought in more infections.
Even Singapore, I think, too, right, Senator?
They saw a huge spike. Yeah. So pretty much all these places are seeing little eruptions here and there, little outbreaks here and there. So that's the way forward. Really is is to move slowly, carefully, and then when you do see, the minute you see a little outbreak or a little eruption or a little spike, whatever you want to call it, you got to snuff it out right away. You got to stop what you're doing, go snuff that out, and that's the only way to do that is to contact tracing, aggressive contact tracing. It's something else I wrote about in my post.
Right.
What a lot of the countries are doing is they're using technology for contact tracing. Now, some countries are taking it probably farther than Americans would want to take it because there comes in ideas of civil liberties and privacy. I'll give you an example. In South Korea, they go as far as they track your credit card purchases. So in other words, if I were to test positive, South Korean government could take a look at, okay, where have you been? Now I would tell them, okay, well, in the last week I went here, here, and there. They take it a step further. They look at my credit card purchases and see what stores and restaurants I was at.
Right.
And then they say, oh, well, you were at this restaurant. You forgot about that one. Then they go and they contact trace in that restaurant, and then they test individuals in that restaurant. And I think they also they have apps that track where people have been. Wow. And then they report that out to the public. So they actually tell the public, like, don't go to this restaurant. There were infected people at that restaurant.
Yeah. So, I mean, Senator, what you're saying is that basically there hasn't really been a success story in the COVID recovery, and places that are semi-successful, I guess is how you would say it, have way more advanced technological and medical ability. So that's why I think it's very, I mean, are we going to be the first place in the world to recover from COVID? Hell no. There's no way. And so I think that just proceed cautiously, like you said, and then, couple that with the testing that we need to do before we implement any recovery plan. Senator, we got to run. We got to do news. There's a whole bunch of stuff going on. But I just wanted to get you on and kind of bend your ear a little bit about your 2 cents on the recovery plan. Appreciate it.
Yeah, it's gonna be challenging, but before we go, if I can just say, I do believe it's possible. If there's a will, there's a way. We can do it. We just got to be careful and methodical in our approach.
All right, thanks.
Thank you.
Thank you.
All right, careful and methodical. 2 words you don't really associate with the government of Guam.
Stop.
Sorry, that's just saying. 8:27. We're taking a little break. We'll come back with Sabrina doing a deep dive into COVID-19 news, and then we'll get Senator Biscoe Lee to talk about her letter that was written to the governor. It's 8:28, again, containing COVID, the KUAM News Takeover, Guam's favorite, I-94.
Join us.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
Against COVID-19, it's going to take all of us to do our part.
We are all frontliners in this epic battle.
And on Tuesday, May 5th, we're asking you to answer the call to help by taking part in Giving Tuesday Now.
It's part of a global initiative to set aside this one day for the pandemic crisis.
To step up and give a donation to any of our island's nonprofit organizations,
the hospital, the Mayor's Council of Guam, or any of our frontline workers. Whether it's PPEs, gloves, masks, canned goods, no donation is too small. Anything and everything will help.
And if you make your donation, take a picture, post it on social media, and use the hashtag GivingTuesdayNow and GivingTuesdayGuam.
And then later that night, make sure to tune in for our half-hour special Giving Tuesday Guam, Together We Give. We'll showcase how everyone is taking part.
Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Hafade Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person in this community to stay home. COVID-19 cannot survive if we do not feed it, and that means staying home and washing our hands. Now, I know I've heard people my age in their mid-20s say, it's okay, we're young, we're healthy, we have strong immune systems, we could fight it. That's not true, and we also don't know who we could potentially be exposing. The only way that we can fight it is if we stay home. It is our duty to stop the spread and to stay home. Be safe, Guam.
Sing it, girl. 8:31, Guam's favorite. Good morning on you. Again, so many ways to catch the show right here on the radio, 93.9 FM. Hagatni Guam, it's Guam's favorite, I-94. There's also live stream, KUAM.com, the KUAM News app. There's an audio stream, Docomo Channel 10. And, of course, all the way live on our Facebook live audience with KUAM News and on KUAM TV 11. It's 8:32. Let's do a deep dive into the day's COVID-19 news from the KUAM News team. Sabrina Solis-Metanani. Good morning, Sabrina.
Hafade, good morning, everyone. According to the latest from the Joint Information Center, released just before 9:30 last night, Public Health tested 37 individuals for COVID-19 on Sunday. 0 testing positive through Public Health, and again 37 testing negative. Now the results include remaining samples from the COVID-19 pilot project testing in Estumbo Dededo. To date, 141 cases of Guam has 141 confirmed cases of COVID-19 with 5 deaths and 128 released to isolation or from isolation. Speaker Tina Mooney Barnes has closed her office following a staffer who presumably tested positive for COVID-19. The test was sent by Diagnostic Laboratory Services to Hawaii for confirmation. The Speaker's office was notified late Friday evening about the staffer. Over the past few weeks, only a limited number of essential staff had been working in the office, while others were teleworking. The employee had been working from home, but this past week physically came to work on Tuesday and Wednesday. All employees who were in contact with the individual, including the Speaker, will be getting tested today. Although the doors to her office have been closed, the Speaker and her staff will be working remotely to allow for decontamination and sanitization procedures. Senator Biscoe Lee, in the meantime, has written a letter to the governor urging her to dedicate at least 10% of the $100 million plus Guam received recently from the CARES Act for direct aid to our unemployed and underemployed residents. Quote, people are hurting because help hasn't arrived. Many can't afford to wait another day. Funding may have been the issue 2 weeks ago, but that certainly isn't the case now. Recently released guidance from the U.S. Treasury allows states and local governments to use CARES Act funds for necessary expenditures incurred due to the public health emergency. The lawmakers suggest the governor could use some of the CARES Act funding for food delivery to residents, grants to small businesses, direct financial assistance to residents, and vouchers distributed to residents for food or other necessary items. The senator saying, quote, they need it now more than ever. Meanwhile, Republican Senator James Moylan is taking matters into his own hands and is hosting his first community virtual forum this Wednesday from 11 a.m. to 12:30 in the afternoon. The senator is hoping people will join the virtual forum to respond to constituents' most asked questions and concerns. Some of those topics that will be covered include transparency, unemployment relief, and assistance. The virtual forum will be done over Zoom. For more information, you're urged to check out his social media platforms. The remaining economic impact payments that the government of Guam is advancing will be mailed out. According to Rev and Tax, about 3,800 checks were transmitted to the Treasurer of Guam. A total of 7,005 checks were printed for a cumulative total of nearly $11 million. These checks are for those individuals who filed and had income of less than $10,000. Checks were distributed in batches to allow for Guam's financial institutions to remain compliant with social distancing protocols. The remaining EIP checks are still pending approval of DRT's implementation plan by the IRS. Over the weekend, President Trump signing a new law that replenishes the Paycheck Protection Program with $320 billion in additional funding. Before the PPP ran out of funding, 508 local businesses received about $102 million in loans as part of the initial PPP, while several local companies were left out because the program ran out of money. Governor Lilian Guerrero opting to cancel her daily media briefing on Friday and instead issued a Facebook Live response to a business owner's message that went viral over social media.
Good morning and half a day. I was asked yesterday at our press conference about my comments and my response to a letter from a Guam business owner. Here is my response. Dear Guam business owner, I live on the same island as you, and though you might feel I'm far away while dealing with this crisis, I've always been right here. I asked you to help, you did. I asked you to close your business so we could save lives, and lives were saved. I asked you to stay home so we could stop the spread, and it is working. I asked you to continue to stay home to keep us safe, and you are. I know you are at home waiting. I told you unemployment checks would come, and we submitted every document for federal approval within days of being allowed to file for it. I told you small businesses grants were coming, and they did. Just ask the 502 small businesses on Guam that got their share of $102 million last week, the largest per capita award among the territories. I told you, don't worry, forgivable loans are coming, and these same loans are forgivable so long as you use them to keep people working. I told you stimulus money is coming, but it hasn't come fast enough, even though we were the first territory in the nation to file for it. That's why I advanced nearly $11 million in stimulus checks to our most vulnerable neighbors, something no other territorial governor has done. During this crisis, we processed $100 million in cash, food, and medical assistance. 500,000 meals were given to Guam kids, and meals to the elderly have never stopped. But still, you wait at home. I know that some people think becoming governor gives you the power to make everything better with the wave of a wand, but that is not true. No matter how fast we work to submit our paperwork, we can only work as fast as the federal bureaucracy allows. That frustrates me more with every day that passes, and I am angry that you are made to suffer because of it. But here's what you need to know. The virus kills and will kill many more of us. We must continue to prioritize the health of our people. We lost 5 loved ones to this virus, and the world lost many more. I won't let their sacrifice be for nothing. In the next few days, I will present a recovery plan that will start returning our lives to some normalcy. It was worked on by medical and public health professionals, the business community, and government agencies like GITA and GVB. My goal is to get Guam working again, but to keep Guam safe while doing it. I've heard you, and whether you agree with my decisions or not, I am glad you are alive to hear me. Thank you, and Sidus Maasi.
All right, and now it's time to go over to the CNMI, where our CNMI correspondent is standing by with the very latest on COVID-19 in the Northern Marianas. Good morning, Tomas.
Good morning, Brendan.
Okay, so go ahead and give it to us with the latest again. Tomas Manglotnia, good morning.
Good morning. And so here's the latest on containing COVID in the NMI. NMI Governor's COVID-19 Task Force Chairman Warren Villagomez, in a highly produced video, announced the arrival of more PPE and PCR testing equipment. We wanted to play part of his statement at the Saipan Airport last week. Here it is.
We're here this morning at Saipan International Airport receiving more assets from Asia. This flight came in from South Korea, Asiana flights. We have behind myself, we have Tyvek suits that are going to be provided to our medical providers, our first responders, defense, DPS, Rota Tinian providers to better protect themselves when they administer care for COVID-19 patients here in the CNMI. As well as the Tyvek suits, this morning we have PCR machines, dry ice machine that came in that would be able to equip our efforts moving forward in a day or two to do community-based testing. So that would make sure that the integrity of the test kits that are being used out in the community gets back to our lab and well validated for testing.
Address over the weekend says that they've had several direct charter flights from California, South Korea, and other parts of Asia, bringing in 40,000 test kits of the 60,000 that were required from South Korea. In addition, 70 ventilators, 48,900 masks, 217,000 gloves, 12,725 isolation gowns, face shields, and hazmat suits in an effort to contain COVID-19. They say that more on the way. Regarding the timeline for community-based testing here in the NMI, a spokesperson tells us that they just had a walkthrough and are starting with medical workers and first responders. CHC and the governor's task force released a clarification on this community-based testing. They say that the request for testing as of now is intended and prioritized for first responders providing for care and for COVID-19 patients and CHCC employees providing direct patient care. That same announcement saying that the governor's office and the task force is developing a strategy which will expand testing to the community. At this time, only community members who have identified a level of risk are being tested for COVID-19. The Medical Associate of the Pacific posting earlier today that there is great news in the CNMI because according to the Medical Associates of the Pacific, the CNMI is ready to roll out its community-wide local testing for COVID-19 infections. We're waiting for the official details from CHC and the governor's office here in the NMI. Also, an update on the ongoing CNMI Fiscal Response Summit on Tuesday afternoon. Tomorrow, the plenary session will reconvene to hear the results of the working groups from the Fiscal Response Summit and closing remarks from the governor and other leaders. We're also waiting to hear official word from the Commonwealth Ports Authority and United Airlines, along with other airlines, on any plans to resume flight as April comes to a close. And right now, I wanted to provide the latest numbers in the CNMI as of April 26th. 14 cumulative number of confirmed cases, 247 persons released from quarantine, 2 deaths, and 11 recovered cases. That's the latest here in the NMI.
All right, thanks a lot, Tomas. Great work. An update now on the USS Theodore Roosevelt. 100% of the crew have been tested for COVID-19 with 833 total positive and 4,100 negative results. A small number of results are still pending. Of the total cases, 112 sailors have recovered and 4,200 sailors have moved ashore. 2 sailors are now at Naval Hospital, and none of them have been hospitalized, or none of them are in the ICU. Meanwhile, over the weekend, the recommendation to give TR Captain Brett Crozier back his ship was made by the Chief of Naval Operations, Admiral Michael Gilday, who had ordered an investigation into his ousting. Here is David Martin with more.
The recommendation to give Captain Brett Crozier back his ship was made by the Chief of Naval Operations, Admiral Michael Gilday, who had ordered an investigation into the head-spinning tale of coronavirus at sea. Gilday's recommendation to reinstate Crozier in effect exonerates the captain for blasting out an email warning sailors would die if the Navy did not act faster to get them off the infected ship. Acting Navy Secretary Thomas Modly fired Crozier for sending his plea for help outside the chain of command.
That demonstrated extremely poor judgment in the middle of a crisis.
because what it's done, it's created a firestorm.
Crozier, who has since tested positive for coronavirus, was cheered as he left the Roosevelt in Guam for what seemed like the last time. Mosley flew there and delivered a rant against Crozier, which antagonized some of the crew.
He was A, too naive or too stupid to be the commanding officer of a ship like this. The alternate is that he did it on purpose.
That speech ignited a second firestorm, which forced Mosley to resign. Afterwards, he required 24-hour security because of death threats against him.
Defense Secretary Esper has not yet decided whether to accept the recommendation. Crozier remains in isolation on Guam and must test negative for the virus before he can rejoin his.
This case is heading toward 3 million worldwide. The death toll has passed the 200,000 mark. Temperatures in the U.S. warmed up across much of the nation. For many, the temptation to be outside was too much to resist. Dana Bacchus has the latest from Los Angeles.
With the temperature reaching into the 60s, New Yorkers tired of staying indoors flocked to Central Park and other scenic spots around the city. Governor Andrew Cuomo's stay-at-home order runs until May 15th. He says the number of new coronavirus cases in the nation's hardest-hit state remains too high, but is moving in the right direction.
Only in this crazy reality would 1,100 new cases be relatively good news.
As many as 1 in 5 New Yorkers may have been infected, according to preliminary results of antibody testing. But the World Health Organization says there is no evidence that people who have recovered from COVID-19 and have antibodies are protected from being reinfected. The WHO cautioned governments that may be looking at so-called immunity passports that would let people travel or return to work. In Georgia, where businesses such as gyms and hair salons were allowed to reopen Friday, safety was on the minds of many.
We are checking temperatures, we're making sure that clients fill out a questionnaire before we perform any type of services on them.
Here in Southern California, a late spring heat wave has arrived, but beaches remain closed due to coronavirus restrictions. Orange and Ventura County beaches are open with some social distancing rules in place.
I think it's okay to open up and let us come to the beaches and take walks and just keep our distance.
And San Franciscans sang their hearts out all around the city by the bay in a tribute to healthcare workers and first responders. Danya Bacchus, CBS News, Los Angeles.
1,600 reported coronavirus deaths. In your Banking 671 report from Bank of Guam and Coast 360, Bankers Association members are collaborating to assist the community in cashing their stimulus checks. In order to adhere to social distancing measures, check cashing is allowed for non-customers at Bank of Guam, Bank of Hawaii, Bank Pacific, and First Hawaiian Bank. Additionally, the GBA reminds the community that ATM deposit and mobile deposit are convenient and safe banking alternatives. Those with no banking relationships may be asked to line up in a designated non-customer check cashing line and will need to provide 2 valid IDs. And that's your 671 banking tip from Bank of Guam and Coast 360. And finally, in order to win the war against COVID-19, it's going to take all of us to do our part. We are all frontliners in this battle. And on Tuesday, May 5th, we're asking you to answer the call to help by taking part in Giving Tuesday Now. Now, this is part of a global initiative that sets aside this particular day specifically for the pandemic crisis to step up and give a donation to any of our island's nonprofit organizations, including the hospital, Mayor's Council, any of our frontline heroes, GFD, whether it's PPEs, gloves, masks, canned goods, to the Salvation Army. No donation is too small. Anything and everything will help. And when you do make your donation, we ask that you post a picture on social media using the hashtag GivingTuesdayNow and hashtag GivingTuesdayGuam. Later on May 5th that evening, we will be having a half-hour special showcasing how Guam gives.
All right, there you go. Thank you so much, Sabrina Salas, Matt Tanani. That was a deep dive into the day's COVID-19 news. 8:49. Wanted to get Senator Biscoe Lee on this morning to talk about that letter that you sent over. Good morning, Senator.
Good morning.
Good morning, Sabrina and Chris. Good morning, Guam.
I guess just first of all, we'll just start at the beginning. You know, media, when we got wind that there was 100 plus, was 117 million that came to Guam from the feds. This was reported on last week by a few of the media. we kind of thought, oh, so we have all this money, but we weren't sure how the governor could use it, how creative she could get, because I think that they had kind of put it forward in Adelup that this was going to be used for reimbursements that we had spent on for just responding to COVID. But so I guess you got a hold of some Treasury Department of Treasury guidelines that came out. And can we just start there? When you got these guidelines, was there like a eureka moment for you that maybe forced your hand to send this letter off to Adelup?
Well, I think, I'll go back. We really wanted to be able, one of the main reasons why we went into emergency session, what was it, about a week and a half, 2 weeks ago, was to make sure that we addressed some of these concerns that we're hearing from our people. We don't know when the stimulus checks will be issued. We don't know when unemployment benefits will come to the people who need them. And, everybody's kind of just sitting in alert, and we needed to provide a bridge for people so that they can make sure they have food on the table and they're able to purchase the masks that they need to go outside of their homes and do their daily business. So I think it was really important for me when I heard from the governor that, she was doing her own kind of bridge for folks, that she was using money from local coffers to be able to do that. We kind of put our bill, the Bill 340, on hold. And so now, just like what you're saying, Chris, we have this additional information from Treasury with regards to the $117 million that of the government portion for CARES Act. We wrote a letter to the governor and asked her to use at least 10% of that money for this purpose. We want to be able to put money into the hands of our people right now. They can't wait for a stimulus check that, while, it might be coming in a week or 2 weeks, we don't know that for sure. We need a guaranteed, even if it's $400 this week, we need to be able to, buy mac and cheese and buy hand sanitizer, buy, disinfectant if we can find it. And so we wanted to make sure that if the governor thinks that she can earmark that $12 million for aid, it's better, but we want to make sure that, we give this direct aid to our unemployed and underemployed residents who really, really need it the most.
What are you seeing and what are you hearing from constituents in terms of how they're struggling and how they're just holding on?
Oh man, we hear from so many people, especially because we have been closely working with the Guam Department of Labor and helping them to figure out the guidance that they're getting from DOL, and I'm the chairperson on labor, so I really try to stay close with Dave De La Sola and his team, and all the information that they have, they share it with us. And so a lot of people have been reaching out to our office with regards to unemployment and all of those benefits, and that's a very confusing situation as well. So we're hearing from folks a lot about that. We're hearing from realtors asking us if we can, and we did this last week. We wrote a letter to the governor also about real estate and the Department of Land Management, and that's something that we can open up today that wouldn't really require in-person interaction. But, a lot of the processes that they do can be done online. So there's no reason why that part of the government can't be open now, and we can't get some of those processes flowing. And so, money can go into the hands of the real estate industry, and, people don't have to put their purchases or agreements on hold or, risk defaulting on some of those things. Those things can move now, and they don't really require in-person contact. So I heard Senator Clint earlier about, some ideas of what we can open up, and I think those are really easy, quick things that we can do that can help for our economy and get some of those things on the path to normal.
What has the response been from Adelup to this letter?
So the initial response for Bill 340 was that they were going to handle it and they were going to take care of using at least $10 million to give to people who have an adjusted gross income of less than $10,000. Right. I was really disappointed in that decision. I felt that our plan, it cost about $13 to $14 million, but it would get money into the hands of people who make $40,000 AGI or less. Right. And so that's like 30,000 families that we could have been assisting. for just a little bit more.
Right, and
So-
Senator, I'm sorry, I thought it was interesting because the governor had compared the amounts of your bill with the proposal that she had put forward, and she had said something like along the lines of we couldn't afford your bill, but it was only really just a couple $1 million more.
That's right. And I really want to emphasize that this bill and this letter that I'm now proposing for the 10% of the money that's received from the CARES Act, that's 10% of the government side of the money, not 10% of your stimulus checks, not 10% of your unemployment benefits. This is a completely separate, different pot of money that I'm hoping to get to families immediately. And now that we have this Treasury guidance, we know that it's within our governor's control, that she can use a portion of this money to give direct aid to people today if we decide to do that.
And I
so
think
that's why I'm really urging her to make that step and to do that.
Yeah, and I think that's important for people to understand that this $117 million that the government has received is separate and apart from the money for the pandemic unemployment program and
Money
separate
for
from the stimulus checks.
That's right. And I totally understand, Bree, because there's just so much information that's coming out. Like you guys are constantly saying, it's a rapidly evolving situation. I mean, it's difficult for all of us to wrap our heads around it, you know? And we're engrossed in this 24/7.
Right.
So
But-
it's really challenging for people to, you know, for the rest of our community to understand because there's just so many moving parts.
But I think this one is pretty easy to understand, Senator, in that we have $117 million, and that Uncle Sam said you can use it to give financial assistance, you can use it to feed people meals, which are two of the, I mean, that's kind of ahead of killing the curve and, you know, making sure we test a lot of people. There's this other, and I wouldn't even call it an undercurrent, it's a raging river of discontent because people, you're right, they're suffering. We thought that the stimulus check, that stimulus check, that's gone already. That $1,200, I mean, what is that even going to do by the time people get it next month? I mean, I'm not saying $1,200 isn't nothing, but people have leveraged against that money. They borrowed from their family members. And I mean, I don't understand why there isn't more of a sense of urgency with this.
And initially, when we were thinking about Bill 340, Chris, one of our main goals was to help people to comply with these orders, to comply with the stay-at-home orders. You can't stay home if you don't have the money to feed your family. You have to, you know, some of these people are so desperate. We're so desperate at this point to be able to put food on the table. Some people don't qualify for SNAP.
Mm-hmm.
And also, SNAP doesn't cover some of these very basic necessities that we now need. SNAP, I don't think, covers face masks. SNAP doesn't cover disinfectant or hand sanitizer. You know, SNAP's for food. So, again, it's a really, like you were saying, it's a really challenging situation. We're hearing from these people day in and day out, and they are our friends. They are our neighbors.
Mm-hmm.
And many people who never thought in their wildest dreams that they would be placed in this situation.
Right.
And so
it just seems
asking for, sorry, go ahead.
No, it just seems that, you know, you put a lot of work into Bill 340, and then, you know, when the moment came that, okay, we're going to discuss this, we're going to try and get this bridge out to people, and then boom, it seemed like you were blindsided with this alternate proposal that came down. And so I'm just wondering, with this letter that you sent out, I know it was just yesterday, but did you get any sort of reaction to it?
So yes, I believe we did receive a letter from the governor. She just noted that she's in receipt of our letter and she appreciates our work. She, you know, will work with us on any legislation if required, and she's looking into this. And then she kind of just focuses again on her advanced distribution of the money to the 10,000 to the folks who make 10,000 or less, and kind of just focusing on what they've done on their end.
Right.
But again, you know, we're not going to stop pushing. And Bree, yeah, it is frustrating that Bill 340 didn't go through, but that has never stopped us in the past from continuing our work. You know, it's never going to be done. So we just need to adjust and improvise and try to find a way forward, because there's absolutely no other alternative. We have to help our people right now. And so I think in addition to this kind of bridge that we're providing for them with this money, we can also think about, and again, this was explicit in the letter or in the guidance from Treasury, that we can do food delivery to residents. We can do on a local level grants to small businesses. We can give them this direct financial assistance. We can even think about vouchers. There's so many different ways we can go, and it can be immediate. That's the thing. We don't have to wait for Uncle Sam to, approve anything. We go for it. We keep our receipts. And
I mean, really, the money has been put where the governor's mouth is. I mean, because she's been saying that, we don't have the money locally. We're waiting on the feds. Well, the day has come. We have the money. You can use it for what people have been asking you to use it for. So now, the ball is definitely in her court. And I'm curious, are we going to slam dunk or is it going to get dribbled out of bounds?
And, the thing is we've been in close communication with them. We have a weekly conference call with senior staff to kind of get an update on all of this. And, as of Friday, when we spoke to them, I understand they also just received this Treasury guidance, a few days ago. And so we're trying to give them time, but we're also saying, hey, we've done the homework too. Right. Check it out. This is what we can do with it. Let's move now. Let us know if you need help. Because that's what this whole thing is. It's a group project. We're all Team Guam, and we need to, help move it along. I understand that the legislature is a separate co-equal branch of government. I know what the governor, what her role and what their responsibility is, but that doesn't preclude us from helping. We don't want to tear anybody down at this moment, but we are saying, hey, we have done the homework. We've read into this. We've done our research, and this is a great way forward. We're asking for just a portion of that money to be given to our people.
Okay, well, can you send us the letter from the gov, and then maybe keep us posted, keep us in the loop of what the response is going to be?
Absolutely, I will. And I just want to take a moment and really thank you both, and thank the whole KUAM team for helping to, get the word out to our community during this really dynamic situation. There's a lot of news, there's a lot of information, so I want to thank you all for keeping people informed. But also I wanted to just say thank you so much for sharing messages from our frontliners. You had a really handsome guy on the show the other day that was at the beginning of the news, and I'm like, wow, he's telling people to stay home, and he just, and shout out to our firefighters and all the people in the front.
Well, I know a guy. Maybe I'll try and get you a pic of that.
Okay, that would be great.
Okay.
And thanks again. And good luck with Giving Tuesday. We'll be tuning in May 5th and figuring out a way that we can help. But we're really just trying to push forward and urge the governor to help the people of Guam in this way.
Okay, Senator. Well, we just got the governor's response, so we'll go ahead and read that out. And definitely appreciate your time, Senator.
Thank you. Be safe.
Wash your hands.
You too. Thank you.
Okay, bye.
Bye.
903, Senator Rogell Biscoe Lee, the Rules Committee Chair from the Guam Legislature. We're KUAM-FM Agutni, Guam, a KUAM News Takeover containing COVID. So I guess they did get a receipt letter from the governor, Bree?
Yeah.
I can read it. Yeah,
okay.
Senator Lee, this is from Senator Rogell Biscoe Lee's office. Senator Lee, it's a letter from the governor. I am in receipt of your letter and do very much appreciate your work in helping our residents get the much needed financial help to continue on with their lives as much as can be normal. I am looking at federal funds that are available and also local funds, as I have done with the advance of the Economic Recovery Program. I'm researching the allowed uses of these funds to make sure that I comply. As you know, if there are unallowable uses, the benefit can be forfeited and pulled back. I will, of course, proceed in any way I can to use the funds as appropriate and legally allowed. I will work with you on legislation if required. I do know that the advanced distribution of the Economic Recovery Program has finally gotten to the hands of of most of the 6,200 tax filers as a start. Again, thank you and look forward to working with you always, Governor Liu.
Okay.
All right.
And as Senator Rogell Biscoe Lee had said that, the legislature, they have been doing their research, and based on the guidance that they received, which was dated April 22nd from the U.S. Treasury, she has made all these recommendations and suggestions to where the governor can use the money. And again, she had vetted the information, and I'm sure some of her colleagues have, and so I don't think that she would put in her letter suggestions that would not.
Is that a stall tactic, though, Bree? Is that how you read that, with the governor's response? Is that, hey, yeah, we know you did the research, we know it's on the official letterhead, we know we got it 5 days ago, but we're just going to go ahead and have our lawyers pour through it and figure out what we can do? I mean, I guess maybe she's vetting it again. But I think that's interesting. 5 days ago, I think the media has asked the governor within the last 5 days about her plans to use any local funds or any type of bridge assistance. Man, and I feel like the pressure is on. The pressure is on Adelup right now.
Mm-hmm.
I mean, if they're going to waste time responding to a Dear John business owner meme, then they can definitely give this the time of day. All right. Hey, we're going to take a break. Sabrina, we got Major Anton Uggan and also Adriana Cotero from the KUAM News team coming up here. It's the KUAM News Takeover, Guam's favorite, I-94. Good morning.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
Self-storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Hafaday Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person in this community to stay home. COVID-19 cannot survive if we do not feed it, and that means staying home and washing our hands. Now, I know I've heard people my age in their mid-20s say, it's okay, we're young, we're healthy, we have strong immune systems, we could fight it. That's not true, and we also don't know who we could potentially be exposing. The only way that we can fight it is if we stay home. It is our duty to stop the spread and to stay home. Be safe, Guam.
Self-storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Specialist Joshua Mansonotia. I can't wait for him to come home. Keep us safe and stay home.
I miss my daddy, and I can't wait to see him. So keep us safe and stay home!
In order
win this war against COVID-19, it's going to take all of us to do our part.
We are all frontliners in this epic battle.
And on Tuesday, May 5th, we're asking you to answer the call to help by taking part in Giving Tuesday Now.
It's part of a global initiative to set aside this one day for the pandemic crisis.
To step up and give a donation to any of our island's nonprofit organizations,
the hospital, the Mayor's Council of Guam, or any of our frontline workers.
Whether it's PPEs, gloves, masks, canned goods, no donation is too small. Anything and everything will help.
And if you make your donation, take a picture, post it on social media, and use the hashtag GivingTuesdayNow and GivingTuesdayGuam.
And then later that night, make sure to tune in for our half-hour special Giving Tuesday Guam, Together We Give. We'll showcase how everyone is taking part.
Good morning. Abracadabra, Kalamazoo, I want you all to have a good day. Yep, busting out our wands. Don't worry, they've got the EUA from the FDA. That's a little bit of Jason J. Mighty Mellow Massive here. Go local, always 912. It's the KUM News containing COVID takeover, Guam's favorite I-94. Let's go over to Mangilao and check in with Major Anton Uggan from the Department of Corrections. Good morning, Major.
Good morning, Chris.
So how are things going over there at DOC?
We're doing good.
Everybody back to work?
Most of them are back to work. I have two people, two officers, two recruits still pending test results.
How many total have been tested?
And why so long? Why are you still waiting for the results, Major?
So far, 17.
17 have been tested?
Right.
Oh. How many are supposed to be tested?
Originally, when all this started, we had 41 recruits and 10 COs that were basically originally told to self-quarantine when this all began. After Public Health did their assessment and their investigation, they determined that 17 of them would be tested. The other 34 were given a 14-day quarantine. And out of that, we're now just waiting for 2. Everyone else has returned back to work.
Okay. What about preparations or anything you guys are doing to make sure that COVID is contained over at DOC? I know that the governor, I think it was during one of the press conferences, she was mentioning about finding, separate areas for pretrial arrestees, setting aside another area for potential isolation and quarantine. What's the status of those discussions?
Yes, we've identified, again, right now, what the process, of course, when a new arrestee comes in, they are screened medically. We do have a medical team. They are screened. They are provided a mask. We give them a mask. If someone does develop symptoms or shows symptoms, they would be quarantined away from the other population. We have a place in Agana that's for that. We also have a place in Manila, a unit that's been shut down for a while. We went in and cleaned it up and done some minor repairs. And that will be our quarantine unit. Now, if they do have COVID and they're determined to have it, then of course we'll be following the medical procedures outlined by Public Health. Mm-hmm. And more than likely they will not be confined in our facility if it is determined they do have COVID.
Mm-hmm. So what about PUIs? Do you have PUIs that are in the isolate?
As of now, no. I spoke to our nurse this morning, and as of now, no inmate has displayed any symptoms or made any, nor the officers have indicated to the medical staff that someone needs to be looked at.
What about last week?
For which one?
You said as of now, but what about last week?
Oh no. Okay. So, I mean the current information is nobody.
Okay.
Nobody right now, including today when I just verified.
Okay. Major, I remember last time we spoke, you had said that there were discussions about re-implementing the incoming for the inmates. Sorry, I had a brain fart there, but someone was asking me to ask you over the weekend. Are we anywhere on that?
Well, Chris, we do have a plan together. We did put something together, although we're still holding off a little bit. Probably after next week, May, the original May 5th, give or take. So after that, we'll probably again evaluate the situation or what's going on in the community, and then the director will make his decision whether to allow it or not.
What about the masks, Major? I know you had said that the director had procured one way or another a bunch of masks, and that those were going to be made available to the inmates and detainees. Have we gotten anywhere with that?
Yes, sir. We did distribute masks to all the inmates. All the inmates do have masks at this time.
Okay.
Yeah.
Sounds like you guys got it under control over there, or do you?
Well, yes, we are. I mean, again, we're doing our best to ensure that it stays out of the facility. Mm. So whatever measures we can take, we will implement just to ensure. And so far, it's been we've been holding strong.
Good for you. Glad to hear that, Major. We also wanted to catch up with you because it looks like the governor kind of tea-licked the AG's ear on this deal that was going down with the release of the pretrial release of the nonviolent suspects. And so the AG had called in, and he really just kind of, told us we don't understand. There's a whole spectrum of nonviolent to violent crimes that they're working on. But then when we asked the governor in the press conference, I mean, she clearly was like, oh, hell no, pretty much. I mean, Lieutenant Governor also was like, this is a stupid decision on the AG's part.
But then the AG said, well, we only made these decisions based on the guidance that you gave us and public health gave us. And so, all right, we're not going to do it anymore.
Right. So where are we now, Major, with that?
I mean, our daily booking is in the average of about four a day, which is still down from pre-COVID. And our releases is about 3 to 4 also a day. We're still getting some releases from the AGs and from the courts, of course. And I think most of those releases, the charges are not as great. But again, DOC doesn't really necessarily play a role. We don't play a role in any of the releases. We just provide the paperwork and the documents, and the AGs and the courts make their decision on who would be out on bail or who would get a notice to appear. But our numbers for the most part right now are still pretty low as far as the incoming and the outgoing of prisoners.
So it's I'm sorry, there's some audio in the background. You said it's still the same, whoever comes in, they're going out the same amount?
Well, we have a few. I mean, it just depends on their charges. It just depends on what the severity of their charges.
Yeah. Okay. So there really hasn't been a change.
No, I mean, maybe they're looking more at the charges and which one's getting released, but in general, the courts are releasing on conditional release and we do have a few that are given notice to appear, but in general, their charges are a lot less.
Okay. In general, Major, or maybe you can send us some of that info, because I know that the AG had, when he called in, he said that, hey, these are nonviolent property crimes where they throw hollow blocks into people's houses and threaten to kill them. It's nonviolent. But then there was also what was it, Bree, a felony family violence or something like that, 3rd degree.
Yeah.
There was some case, and so we're just curious because the AG said one thing, and then when we kind of went into the info, it was another thing. So are we really only releasing nonviolent offenders, or is it a judgment call like it was a couple weeks ago?
Yeah, well, I don't have all the charges in front of me for the past 2 weeks of who came in with what charges, but in general, we're getting about 4 and releasing 4. I mean, I I can check at the numbers and then provide you some more information on it. I don't have all the
right on, Major. Appreciate
in front of me. And again, I don't see all the reports, and of course we don't get police reports, and we don't see any of the facts behind any of the cases, really.
Right.
And so, yeah, we just release when they say release and hold them when they say hold them.
We had a comment here. How about incoming prisoners? Are they being tested, Major?
No, sir. We are not testing anybody at this time. When the prisoners do come in, they are medically screened for symptoms to include a temperature. They check their temperature. They are put in one side of, they're issued a mask and they're put on one side, pending their magistrate hearing later that day or the next day. Again, most of them coming in have been getting released within 24 hours. And so there's no need. Now, if they develop symptoms, then again, we refer back to our medical staff, and our medical staff will make the determination on whether or not they have to be tested. DOC ourselves, we don't have to.
You don't have any test
but
kits, right?
the new expanded testing guidelines is that anybody and everybody that is experiencing COVID symptoms, they must get tested immediately. I don't think there was any kind of, but if you're inside DOC, you don't get tested. So.
No, but again, like I said earlier, no one has displayed any symptoms. So if no one's displayed symptoms, then obviously there's no test given right now.
Right. Did you guys put out maybe a Major, announce it over the PA, like, hey, if you have loss of sense of taste or smell, or any of these, how do the inmates know that they're supposed to represent to you guys that they might have these symptoms, or are you guys telling them?
Yes, sir. I mean, even when they come in their process, that's part of the process. They're informed.
Mm-hmm.
We also have posters throughout the facility. Officers are aware of it. I mean, it's in our briefing and on our daily briefings with the officers to just, again, be on the lookout.
Do you guys do similar to what TR does, where they do medical checks every day of all the inmates and detainees? Or is it just you wait for people or the inmates to say, I'm not feeling well?
I mean, no, the inmates, again, when they first are screened, there is a sick call if they're not feeling well. I don't believe the nurse will see all of them every day.
Okay.
Sometimes we only have 2 nurses on duty, so they won't be able to see every prisoner every day.
Mm-hmm. Or temperature checks, or
Again, if they develop anything, we do the temperature checks for our staff as they report for duty every day, but not all the prisoners every day.
Mm-hmm. Okay, just thought I'd check.
Yeah, but again, if someone does say any kind of symptom, they of course will be referred to medical, and medical will handle it from there. But again, as of today, as I spoke to the nurse this morning, there is nobody that has come forth with any sort of symptoms, not from the inmate or the officer side.
Okay. Well, that's good to know. Appreciate you checking in, Major. Is there anything else that you want to get out there? Because we do have a lot of family members of inmates and detainees listening, and they're always putting stuff in the comments. So, we just really try to go back to the prison, at least on a weekly basis, to kind of give them that peace of mind, right? Because they don't have the visitation. They don't get to do the incoming. So what would your just message be to those people out there?
Again, we're holding strong. I think we've done a pretty good job to this point, trying to keep COVID-19 out of our facility. We will continue to do that. And again, the incoming, the director understands the importance of it. And we do have a plan together. We're just waiting for the right time. You don't want to jump too fast and we do something different from what we've been doing, and all of a sudden now we have people getting infected. Because then that will definitely stop incoming, and everything else would get a lot harder on how we do business in here. And so we're just doing our best to maintain it, and as soon as the time is right, the director will allow the incoming to resume.
I actually had another comment here, Major. Received a call from a DOC guard asking about the double pay received while in an emergency state. He can't seem to get an answer from the director's office about whether or not corrections officers qualify for this.
Well, I the double pay, none of us at this time has got paid any double time. That is,
What's your understanding of that, Major? I mean, because you've been around the block. You're a classified long service employee. Is that what your take of what the law says? Is that anybody who's working during an emergency like this one should be getting double pay? Because a lot of people are expecting it.
Well, my basic understanding of the rules and regulations is yes. Under the Department of Administration rules and regulations, there is something about hazard pay when it's declared an emergency. I mean, at double time. I know the senators just recently passed another bill that had to do with specialty pay, and also it mentioned double time pay in there. But again, that's my basic understanding. But I'm not the legal advisor, and I'm not the one who makes the final decision. So, like most employees, we're just waiting to find out whether or not that's going to happen or not. We don't know.
But you've gotten it in the past, though, right? Whenever there's been a public
give us an example, Major.
Emergency.
Well, again, on the emergency, generally typhoons.
Mm-hmm.
So when the typhoons come in and we go to condition 2, from that point forward, the officers are getting double time. Anyone that is on duty will get double time until condition 4 is announced.
Mm-hmm.
But isn't this one long condition too to you guys?
Yes, this is a typhoon without the damage, the damaging wind and the loss of power. But and I guess that's how some of us see it.
Yeah. So what are your guys saying, Major? Because I've heard this from people at the hospital. I've heard it from a bunch of people, but we just haven't really been able to nail down. Is it in black and white?
Well, again, we don't have anything final from the administration, what's going to happen. But
all right, okay.
Of course, talking about someone's pay and the pay issues are always very sensitive.
Right.
And I don't know all the specifics of what's going on behind the scenes in regards to payroll. I, like most, are just waiting to find out what direction will be given in regards to it.
But have they been expecting it, Major? Was there a point where that first paycheck they were expecting to see it?
Yes, I think in general most officers are expecting it because of what the rules and regulations say and what our past experience has been when an emergency has been declared. But again, in regards to this, I guess we're just going to have to wait and see what direction it takes us.
Maybe we'll check with the oversight. Have they sorted out who you guys' oversight? Is it still Senator Tolina, or has it gone back to Senator Pito?
As far as I know, it's still Senator Pito Tlali.
Okay. So we'll check with him. Yeah, that is interesting, and we have been hearing that. And I know that the governor had proposed some kind of sliding scale, the 25%. And it's funny because when she came out with that proposal, I think this was a few weeks ago, I got a lot of messages on my WhatsApp where people were like, "Hey, it's supposed to be 25%. It's supposed to be double time." So I think we're gonna try and track this one down for you guys.
Yes, sir. I think a lot of it just has to do with the huge amount of money that would be paid out in the event something like that. I mean, it would be for this long of an event. This is pretty. It's going to be pretty expensive.
Yeah, but that's something that I believe the federal government would probably have to reimburse. I mean, I don't know.
Yeah.
Okay.
Again, I don't know the specifics behind all that and all the mechanisms behind the scene. I'm not really.
It kind of seems like you're scared to say it, Major. Like, you're going to get in trouble with the director. But you're basically saying, in your experience in past disasters, you guys have gotten paid double time. It's not happening now. That's the black and white of it. Facts.
That's the basic right there.
Okay.
All right.
Okay. Thank you, Major. Anything else?
No.
He's like, no. We're good. Thank you, Major. I wish we had a magic wand to just wave away all your problems over there at DOC, but we're waiting on the shipment, all right?
Yeah, yes.
Okay.
All right. Take care.
Wash your hands, Major.
I will, sir.
Thank you, sir.
Okay,
all right. Man, that's one of my COVID heroes right there.
Yeah.
Major Anton Uggan. I mean, really just a long-time a staffer at the Department of Corrections. It's really an example of, administration to administration. We bring in these, political hires to run the show. But, and you guys know in the government, who really knows what's going on? It's not the unclassified. It's the classified people who put in the work decades. At 9:30, let's go to Adriana Cotero. And Adriana, I don't know if you heard that interview with the Major, but pretty interesting stuff. It kind of seems like he was saying that minus the incoming, that they kind of have it, I mean, knock on wood here, they kind of have it under control over there in Manila.
Yeah, good morning. Hi, Chris. Hi, Bree. Happy Monday to you guys. Yeah, I was listening in for a bit there until I had to turn off the sound so I can get on here. But yeah, so I know that early on they had put their restrictions and their protocol in place, and while everyone else was doing, a mandatory 2 weeks, they had set their guidelines for an entire month. So I know that it's nearing the end date here. So that was going to be a question I had, is do they plan to lift some of those restrictions then, since it's been that 1 month, or are they going to continue? Are they going to let some incoming? And it sounds like they do, for the most part, have it under control, because there was a moment there where I think all of us were kind of in fear that there could be an outbreak in the prison.
And so you had told me last night that they've done the mask thing. That other than the incoming, that's something that they're working on. Are you satisfied with the resolution of the testing of these recruits? He had said they're still waiting for 2 of those test results.
Right. So yeah. I had asked. It's something I had kept on asking, or at least requesting information on from Anton. Is where are we at with those testing? How's it going? How many people have tested positive? And he's always gotten back to me right away. But interestingly enough, whenever he had first told us that the Department of Corrections recruit that tested positive, and that there wasn't 17 officers that were in close contact in the beginning, is what it was at first. I think it was only about 13 that they had mentioned. So I guess there was others that came out of the on-site visit that happened with the public health CDC staff. And so then, but since we found out then there were 17 that were in close contact, the last I had reported was that 11 of them had been cleared from the virus, and that there were still 6 pending results. But now there's 2, so there haven't been any confirmed cases then with that, which is great. And also last week he told me that recruit who did test positive was expected to start back up to work at the facility, and that he has gone through the mandatory process of allowing him to be cleared to return to training. So there were more that came out of it initially whenever they first reported the recruit and how many people were in close contact with him. But as far as we know, there hasn't been any other confirmed cases from the prison.
Can we switch gears to education? I know that she covers crime and education. So what do you have on education for us, Adriana?
Yeah. So I was going to give a quick update. I like to check in at the beginning of the week with Department of Education, just asking about the grab and go program, because we know it's been rather successful and there has been a demand for it. So as of today, they have served 530,000 meals to date, and that is since their start date, which was on March 23rd. As we reported last week, the governor approved the $1 million in support needed to continue the program throughout the summer. So this isn't something that the department would normally budget for, which is why they needed the approval for the support. And Superintendent John Fernandez had said that they are now in the process of confirming details with the U.S. Food and Drug Administration in order to move forward. So it's looking like the program will, for the most part, continue throughout the summer. We know for sure it's going to continue until April 7th. But as far as just
August 7th.
Yeah, August 7th. Yep.
Okay.
And so then there's just, I guess they're in the process of just confirming with the feds right now, but that the local amount was approved. So that includes, GDOE staff volunteering from 11 a.m. to 1 p.m., serving 24,000 meals still, and that breaks down to 12,000 lunch and 12,000 breakfast meals to all the students on island at the 12 site locations still. In addition, since they've already served 430,000 meals to date, by the time we actually, if you think about it, by the time we actually reach the end of the originally set school year date, which is the end of next month, I know something that Fernandez said that I kind of noted and acknowledged was that we would be reaching maybe nearly 1 million meals served by the end of within the next month, which is that's a lot of meals served.
Yeah, it's pretty mind-boggling. And again, we've been saying this since the beginning. DOE, this is the first GDOE. This is the first thing that they really kind of, put their heads together when the decision was made that we weren't going to have classes. They said, "Oh, how are kids going to eat?" And so I really can't thank them enough. It's been amazing, and I just wish that there was that same dedication and drive to provide the same type of assistance from the rest of the government of Guam, and specifically the governor's office.
Yeah, it was definitely something they pushed for early on, and actually it was before they even determined if the school year was going to end early or
You're
not.
right. You're right.
It was right away whenever they closed down the schools that within, I think it was only within like 5 days or what have you, they started the program right away, and then they saw how many meals they needed, and they started bringing more in and more in. So,
right.
It has been their push, and then they also did the home learning resource page, which is available still and includes weekly lessons and that's online at gdoe.net. So going back, you said over 500,000 meals have been given out by GDOE. Yeah, to date. So I just got that number this morning. So 530,000 meals.
So that's exactly. 500,000 meals have been given out on Guam.
Since March 23rd. So within a month.
Wow.
Yeah. So that's why I'm saying if you think about it, by the time we reach the calendared end date, which would be in a month from now, we very well may reach 1 million meals served on Guam, and that's to all students again. So not just public schools, that's private, charter, everything. All students.
Great. I just want to give them another round of applause. We give them, pretty much every morning, but that's just amazing.
Exactly, and that's why it's something that I've wanted to continue asking, especially at the beginning of the week, just to see where they're at, because that number it just continues to grow and grow and grow. So
right.
We will see, and then if it does continue throughout the summer, who knows? We could be reaching 2 million, 3 million, even more. So. Another school that I had spoken with last week was the Science is Fun and Awesome Learning Academy Charter School.
Right.
So they had just recently, they made a decision to have students' third quarter grades roll over to their fourth quarter grades, and there's roughly about 235 students there that attend that charter school, and they're going to be implementing virtual lessons as well for the remainder of the school year, but those will be graded, and they'll be adding a percentage to the fourth quarter grades. So I had spoke with the principal briefly, and he mentioned that they're still determining how the final grading will work for the fourth quarter, and he wants to follow up this week, actually. But I thought something very interesting that with their virtual lessons that he mentioned to me was that the main reason that they wanted to continue was to provide some normalcy to the students, and they're planning to include in their lesson plans some coping mechanisms for students during this time, because they said that a lot of their students, they have parents that are, on the front lines, and they've even just had students reaching out. So they wanted to provide some coping mechanisms. So the principal was mentioning to me that he would actually be interested in doing a Zoom interview where they could actually provide those coping mechanisms for the entire island as well that they plan to bring on.
Oh, that's good. That's good.
Yeah, I thought it was kind of good, especially because, we're reaching over a month. We see people getting restless, and I'm sure there's, there's a lot of different things, dealing with mental health and the different stresses that come with each day. So I thought it would be really interesting to get him on here as well.
Definitely.
So you mentioned they're meeting tomorrow, so hopefully we'll plan something midweek after they meet and decide how they plan to implement that course into their virtual lessons, and then how they plan to do their final grading.
Okay, Adriana, appreciate it. Anything else you want to add and share with us what you're working on for today?
I think additionally the other thing that I plan to work on, and I wanted to follow Sergeant Paul DePauw on, is that, last week, early in the week, I think it was on Monday, there was a break-in at Rogell Elementary School, and then on Thursday there was another one at George Washington, and another one on Friday. So, and I think they're still looking for any suspects when it comes to these cases. So I just wanted to speak with him roughly on all these break-ins that have been happening, and if anyone does have any information, of course, contact GuamCrimeStoppersWeb.com. But yeah, just, there's just been quite a few break-ins lately in these schools.
Well, good eye, Adriana, good eye. Thank you.
Yeah,
okay.
Of course.
Wash your hands.
Yeah, you too.
Do your meditation.
Yeah, I will.
I know you will. Okay.
Well, I just wanted to pass along that the Guam Fire Department, they just released information about the incident that occurred Saturday night involving a missing spear fisherman. GFD spokesperson Kevin Riley saying that E911, they received the call around 9:30 p.m. Saturday. A man in his late 40s, early 50s had been spearfishing at Pago Bay Units responded from Jutnya, as well as Rescue 1 and Rescue 2, the Coast Guard, HSC 25, and the man's body was located inside the reef again in Chalampago about an hour later, and his identity has not yet been released. So I guess that's something we can also look into for today.
Okay. Thank you, Adriana.
All right. Bye, guys.
Be safe. See you. 940, Guam's favorite.
We've been getting some comments since Adriana was bringing up, how DOE is going to handle fourth quarter grade postings. There have been some people that are saying, it's not as big of an issue as, unemployment or, feeding people that have no food. But still, to a great many people in the community, graduation is like a big thing. And, what's going to happen with that? So I'm trying to get Pat Bennett, who is the principal of St. John's, because my mom worked at St. John's, so I kind of have a little bit of the inside track on what's going on there, not too much. But also, she was my vice principal when I was at Sanchez. I know Chris, she was the vice principal at GW for a long time, former education board member, so she's got a lot of experience in dealing with this kind of thing, but nothing ever like this. So how the various schools are going to try and facilitate things. I know some schools are actually leaving it up to the students and saying, how would you guys like to proceed? They're saying, do you want to do a virtual thing? Do you want us to mail you your diploma or anything? I mean, it's all up in the air right now. But,
right, it is.
But and it's all about the kids. So even like we're seeing like a lot of the faculties from elementary schools are making those really cool Instagram videos to keep students motivated. Right now, what they're trying to do too for graduating seniors is saying, we can't take this moment away from you. It'll be different, but you still earn, the right to be recognized and to be celebrated.
Thank you for that, Jay.
Yeah.
All right. Yeah, that's something that, they haven't even, I know there's been discussions. I've heard things about drive-through graduation, drive-up graduation, virtual. So, yeah, it's not, like what he said, it's not as important as unemployment, but to this kids. Okay, what do you got?
From the Agana Heights Mayor's Council, Municipality, Agana Heights Mayor's Office. Okay. It's kind of blurry because I'm trying to blow it up, but they are asking for parents, I guess if you have somebody that's graduating, 2020 high school graduates and 2020 college graduates of Agana Heights, to submit a photo, their name. This includes a high school, college. They're asking for high resolution photos, and email it to mayormcdonald@hotmail.com. They want all these pictures by Friday, May 1st at 12 noon. They're going to display all graduate banners along Tituan Park, Agana Heights, in honor of our class of 2020 graduates.
Wow. So thank you, Mayor Paul McDonald. That's pretty cool.
I'm going to ask for a better copy because I can barely read it. It's so tiny, and when you blow it up, it gets it's blurry.
Okay. Well, there you go. 9:43. Hey, we got to take a little break, and we're going to come back and end the show like we always do on a nice, positive note. It's 9:43 again. The KUAM News Takeover, Guam's favorite, I-94 containing COVID. Good morning.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc. Be healthy. Be informed with
New self-storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Hafade Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person in this community to stay home. COVID-19 cannot survive if we do not feed it, and that means staying home and washing our hands. Now, I know I've heard people my age in their mid-20s say, it's okay, we're young, we're healthy, we have strong immune systems, we could fight it. That's not true, and we also don't know who we could potentially be exposing. The only way that we can fight it is if we stay home. It is our duty to stop the spread and to stay home. Be safe, Guam.
New self-storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Specialist Joshua Manson out here. I can't wait for him to come home. Keep us safe and stay home. I miss my daddy, and I can't wait to see him. So keep us safe and stay home.
This war against COVID-19, it's going to take all of us to do our part.
We are all frontliners in this epic battle.
And on Tuesday, May 5th, we're asking you to answer the call to help by taking part in Giving Tuesday Now.
It's part of a global initiative to set aside this one day for the pandemic crisis.
To step up and give a donation to any of our island's nonprofit organizations,
the hospital, the Mayor's Council of Guam, or any of our frontline workers. Whether it's PPEs, gloves, masks, canned goods, no donation is too small. Anything and everything will help.
And if you make your donation, take a picture, post it on social media, and use the hashtag GivingTuesdayNow and GivingTuesdayGuam.
And then later that night, make sure to tune in for our half-hour special Giving Tuesday Guam, Together We Give. We'll showcase how everyone is taking part.
Takeover of Guam's favorite for containing COVID on the 27th day of April. It is Monday. Someone had asked, just from what I was able to add up from the JIC release, someone had asked how many people total we've tested on Guam, and the number I got was 1,387. And that's just adding the different number of negative cases there. So.
Okay.
Yeah. 9:52. Good morning on you. We always try and end the show on a good note, and we're going to try and do that today and head down to the village of Melissa, where we have resident Steve Cruz on the line. Good morning, Steve.
Hey, good morning, Chris.
Good morning. What a great thing you guys did over the past weekend with your free mask drive.
Thank you very much. It was well worth it.
Mm-hmm. And so, if you could go for viewers who aren't aware of what you did and your wife Abby, I believe it was April 24th. That was a Friday.
Correct. It was Friday. Initially, we put out flyers in the village store saying that from 10 to 12 we'll be passing out free masks, and my wife and our kids. It was a family project.
Mm-hmm. And you guys actually distributed a lot from what the pictures that I've seen, and I think we have some of the pictures if we're not rolling them.
Oh yeah, we did it from 10 to 12, and we decided to come back 4 to 6 to catch a lot of people coming home from work that day, and we just parked there at the Santa Maria and Carmelin Park, and we caught the motorists going both directions. Actually, our village traffic is very slow, so we're able to do a drive-by and pass the mask out, and it included not just the villagers, but people from the neighboring villages that were going through, Guam workers that were in their official vehicles, and private sector employees that were going by. We just gave them out.
Mm-hmm. What made you decide, I'm going to do this? I want to reach out and give these free masks.
Well, the people in Marisa have been adhering to the protocol, stay home, be safe, and times they all have to go to the mom and pop stores to get whatever they need, and so we decided just to give out masks, and they were all, everybody needs it. We're all trying to practice be safe, and it's a very simple gesture.
Mm-hmm.
How many masks would you say you guys were able to give out, Steve?
About 1,000. As a matter of fact, we just left Marisa maybe about 40 minutes ago, and we delivered to a couple of houses that I guess weren't able to go out and get any. So, we had put out that anybody needed it while we still have supplies. We'll deliver it.
And this actually, because we have some of the pictures that were rolling, you didn't only just deliver or hold masks, a mask drive, but you also did something else, and I think that's worthy of sharing with people for the Manumco in Mauricio.
Yeah, I think it was last month we put together some care packages, and we delivered them to the Manumco, the ones that are homebound, a few of them up at the senior citizens housing area in Mauricio, and they were miscellaneous items to include even toilet tissue. I mean, everybody needs something, like that. And
so you were one of the people hoarding toilet tissue. Okay,
it was you. Got it.
We cornered this the market. Yeah.
Just kidding.
And what are they saying when you go and you deliver these things with a mass drive? What was the response you got, Steve?
Well, from the Manumco, they really appreciate it. Like I said, we had like soup, we had snacks, we had different items in there, and they appreciate the visit, first of all, and the company and just to deliver. And we didn't stay long because we don't want to, it's just a drop and deliver and hello and goodbye.
Okay.
I'm pretty sure, though, some of them in Manumco are probably like, hey, you want a hamhaka mungo bean? I just made a pot. But they were trying to give back, right? Because there's always that enough maulik and the reciprocity.
Just as a matter of fact, this morning, the house that we went to deliver, the guy was saying, hey, I'm making some coffee, have some coffee. And I said, I'd love to, but because we're not, we have to practice that social distancing, I said another date. I said I'll be back, and we'll have that cup of coffee.
All right. Well, thank you so much, Steve, for what you're doing for the people in Molesto. Any final comments before we let you go?
Yes, you and Chris are doing an awesome job. Thank you for your service, and appreciate updating the people of Guam with everything that's we're going through. It's uncharted waters that we're traveling, but keeping us informed is a great help.
Well, appreciate that, Steve.
Thank you.
And the show's only going to get better now that we got our magic wand in here.
All right, come down to Molesto and visit us.
Okay.
When it's clear to travel.
Thank you. Okay.
Take care.
Hey, wash your hands.
Okay.
All right.
Okay.
Okay, Steve and Abby delivering or holding a free mask drive for the residents in Molesto.
1,000 masks.
Yeah. And also prior to that, last month, they had put together these care packages, I guess you could say, and then they delivered it to the Manumco in Mauricio. So good on you. COVID heroes.
Definitely. 9:58. Did you want to go over the numbers one more time before we go, or?
Well, we're still at 141 confirmed cases. There were, about over 80 tests that were ran through public health. And this included some from quarantine sites and the 52 from the Estumbo Community Pilot Testing Project. Only 52 actually participated. I know the goal was to test 100. 52 came through the drive-through and the walk-in, and it appears all 52 tested negative.
I know. And now I guess the next question would be, where are we going next? We've had the mayor of Agate say that they're looking at someplace in Agate. Jigo Mayor Rudy Matanani said he was told they're going to do a drive-up testing at the Jigo gym.
Mm-hmm.
We're wondering where to go next. But, as far as today's big announcement, what we're hearing is that the governor will be making a big announcement. We've been told they're going to have a press conference today.
Well, we hope they will. I mean, right, yeah. I think you spoke with somebody up there, so you would know
we're
more than I would.
That they're going to announce something today, and then hopefully tomorrow we'll get the lieutenant governor on to talk about what they're planning to announce. What are they planning to announce? We're hearing it's going to be the recovery plan, which includes plans to reopen Guam incrementally and based on test results from community mass testing. And we can only hope that when they say community testing, they mean more than 50 people.
Right. And just as a reminder, if you're feeling sick, that's the new strategy to search and destroy COVID-19 on Guam. If you are feeling sick, have any of the symptoms, you are urged to immediately contact your physician, contact public health, and get tested.
There you go. And so, yes, the message has been stay home, and now it's stay home and only go to get tested. You need to do your best to go get tested and, get essential groceries and stuff, okay? It's 10 a.m. Hey, we want to thank everybody for listening to us on the KUAM News app at KUAM.com. Again, here on the radio, 93.9 FM, and streaming live on our KUAM News Facebook page. Thank you guys so much for all your kind comments.
And just a reminder, 1 o'clock, we're hoping, stay tuned again and log on for the governor's press briefing. We haven't heard there's going to be a change. As far as we know, it'll be at 1 o'clock, possibly 1:05, maybe 1:30, but there should be one today.
And I look at it, it's a briefing. The press gets asked questions, but it's really, I think it's become a briefing for the people. Right.
Yeah.
And so that's where I think it's important that we remember that on all sides, that, especially at the governor's office, they might, cancel a press conference because it's a bad news day and, somebody don't want to answer questions, but you're not canceling it on us. Mm-hmm. You're canceling it on the people. So on that note, it's 10 a.m. Bree, good job today.
Good job, everybody.
Good job on you guys. Thank you to all of our frontline heroes. I want to give a shout out to everybody who was out there at Estumbo on the public health side, on the guard side, for going out there and going out on truly on the front line. Mm-hmm. And, risking.
The governor was there. You saw the pictures.
Was also there, and so was the chief of police and the tag, and also the fire chief. So they were all out, and it's 10:02 now. We are out of time. That's it, Pat. For Sabrina Solis, Matanani, Guahusi Chris, this has been Containing COVID on Guam's favorite I-94. Adios!
Bye!